Welcome back to Bark and Banter, real conversations for better dogs.
From treating a nervous pug in the back of a converted ambulance to providing end-of-life care at home for your pets. Today we're going to be talking with Dr Laila from Edgewater Mobile Vets.
So let's dive in.
Present with worse backs than dachshunds. People don't know that.
No, we didn't know that.
No, I didn't know that. You.
I am not local. As some of you know, having spoken to me, I have an American accent.
Right, today we're talking to Dr Laila from Edgewater Mobile Vets.
Yes.
So hello and welcome.
Hi, how are you?
So tell us, where are you from? Because you're not local, are you?
I am not local. As some of you know, having spoken to me, I have an American accent. So I'm American. I'm from Chicago originally. And actually that's played into the logo and the name of the practice because Edgewater, we're nowhere near water around here.
I did wonder.
There's a little bit of river down the road.
We have rivers and some reservoirs, but Edgewater is actually the neighborhood I grew up in the U.S. in Chicago. So, so that's where that name has come from, and some of the logos and things have come from that.
So how did you get to be a vet then? Tell us all about your journey and where you trained.
Gosh, so I, growing up in the U.S., I knew I wanted to be medical. I had family, a godfather that was medical. And you'll ask a lot of vets and people in veterinary care, you know, why aren't you a doctor? Why aren't you a nurse? And I'm like, oh, people are gross. That's sort of how we kind of come about it, is you kind of go down this pipeline. Some people knowing that they want to be vets. I had no background of veterinary in my family. But as I was sort of going down this medical, you know, I really loved medicine. And as I was kind of training and pre-training in high school and university, I discovered through volunteerism, which we do a lot in the States actually, that I really had a passion for the pets rather than the humans. And if you ask me, it's mainly because nothing that the pet does is ever the pet's fault. You know, they go through some of the health concerns in their life, but they are never at fault for them. No. And that is, treating an innocent is a calling, I think. Yeah. And I'm very privileged to be a vet. I love what I do. Absolutely. And then so making that decision, being in the United States, there's a lot of factors that went into me leaving the U.S., including financial. It's very, very expensive to become a vet in the U.S. So I went to Greece, where my family's from, and I qualified there, and by virtue of being an EU citizen, I ended up here. After having done some internships, I qualified for an internship at the University of Bristol, kind of looked around and I said, hey, this is not a bad place to be in the UK. It has really great veterinary medicine. You know, the people are wonderful. And so I ended up staying because I just really liked it here in the UK. And I left from Bristol to work in and around London and settled here many years ago. Yeah.
Wow. Some journey to get here, then, isn't it? So what inspired you then to leave traditional practice and then go into, you know, the mobile?
Yeah. So to be clear, I've not fully left traditional practice. I still do it some days a week. Mainly is that the practice of veterinary medicine itself has changed. So when I first came to the UK, being a girl from the city, they said, and when you go to these house visits, because you're legally required to. And I was like, what? Who is going to somebody else's house? I was actually shocked. And I said, I'm not going to somebody's house. You don't do that in Chicago. So that was something that was very much part of the tradition in the UK, that the vets would leave the practice, would take care of the pets at home, and it was their clients and their patients. And because of the way veterinary medicine has become corporatized and various changes happening, there's not enough staff to do that right now. And I was in practice, you know, and I still am in for many years, and just talking to the clients, just having the conversations with them inside of the consultation room and listening to kind of their concerns and watching their pets nervous, watching them struggle to get their pets in the clinic, all of these things. And they would say, oh, I wish I had a vet that was available on a Sunday. I wish I had a vet that was available. I wish you were available to come to my house. I can't get my pet into the cage or the car or whatever it is. I really struggle.
It always is a fight, to be fair.
It's a fight, especially for some pets. And then what happens is that pet doesn't get the care they need, and the owner feels really guilty. And why can't we bring that to them, you know, and we have done for so many years.
And he's actually struggled to get a vet out.
Yeah.
Unless your dog's dying.
Yeah.
Most, you know.
Well, even then, sometimes now,
That's it. A lot won't come out to you.
Yeah.
No, you've got to come to the practice, which I always think is a bit bizarre. So when you say, you know, that facility's there, I don't think many vets do they? There are a few that will come to you,
There's
but
a
it's
few
normally end of
left.
life.
I think it's a thing that's got lost, I think.
Yeah, I think
It's a thing that's gotten lost, not because of the vets. Like I said, the realities of what's happening in the business are such that they're not staffing them appropriately to be able to leave the patients in the clinic to go to the homes. They're putting the patients in the hospital at risk if they leave them, because you have to leave, you know, even if you're right next door, you have to leave for a good hour.
Yeah.
And if you don't have enough nurses and if you don't have enough other vets there to take care
There's not
of
enough
those
cover,
pets,
is there?
there's not
No.
enough cover. And so you have to make that decision from a health point of view.
Yeah.
As a vet, and I have had to make those decisions, you know, to say, I'm sorry, I have no capacity to come to you because I have these pets that are very, very sick. So, well, why don't we take off some of that burden and offer that? And so that's why I'm doing it. And plus, it's really nice to get out and see people and drive in our lovely countryside in between appointments, you know. And
It's nice around here,
it's
isn't it?
gorgeous
It is,
around here, you know.
is,
And so when the veterinary industry is becoming much more industrialized and, you know, you have to hit, you know, 15-minute appointments every time, I am able to give the luxury
A little bit more.
of more time, more convenience, less stress, not more, but less stress, things like that. Yeah, more comfort, really.
So tell us about your practice then now. You have a converted AMBO, I know that.
I do have a converted AMBO, I do, yeah. So we're based out of Edenbridge, and we cover basically about half an hour around Edenbridge. The map is on the website. Basically hitting also the major towns, so Tunbridge Wells, Sevenoaks, of course, East Grinstead up to Caterham, a little bit north of that, a little bit further north of Sevenoaks, and then all areas in between. And basically, right now we're operating mainly on the weekends, Saturdays, Sundays, Mondays. During the week, because like I said, I do operate out of another clinic during the week sometimes. It's by appointment and by previous engagement. And mainly it's to cover that gap.
Yeah.
It really is to cover that gap. It's not, you know, if a pet needs to see me regularly, I'm there for it. I can do everything that a general practice can do inside of the consult room. I can't hospitalize. I can't do major surgeries. There's some things that I can do, but it's really there for when the other clinics close and people really are struggling. And that's the other thing. Yeah. People really struggle for something that needs to be seen, but you don't really want to go to that emergency out of hours, especially on the Sundays.
Yeah, that's quite prohibitive.
It can be quite prohibitive, especially for something that, you know, you're going to wait about 3 hours. It's become like A&E. You know, it's very much private medicine, right? So you have to pay all that money. And I have been in that situation. I've been an emergency vet for years. And I've had to tell people, you know, you can wait till tomorrow. It's fine. Yeah. And these lovely people are so worried about their pets that they bring them in. And I was like, you know, had you waited till tomorrow, you would have paid a third. You know, stay at home. And you're trying to tell them that, but of course you can't because people are worried. People love their pets. They don't want them to suffer. You know, and then, you know, obviously they don't have the staffing levels as well. So if you have 5 emergencies that are dying, your lovely little pet's going to be waiting and you're worried about it. You might not know that one is not the most urgent. In your mind, it is the most urgent. So this way it gives a little bit of a relief of a little bit less money to come to us in Edenbridge on a Sunday for the standing clinics, and a little bit more peace of mind that your pet is going to get taken care of until either you stay with me or your own vet opens in the week.
And I suppose continuity as well. If someone's registered with you, that they know they're not going to be seeing a different vet if there's an emergency on a Sunday.
Right now it's me.
You can see anyone, can't you? You know,
absolutely.
At a lot of practices, you don't know who you're going to see.
Well, and that's the thing.
And quite often they're staffed by... I suppose agency staff, aren't they? So sometimes you'll see vets that actually are just coming in locums.
I mean,
which again is a bit, you know...
That's a bit of a deep dive right now. The agencies aren't getting as much involved. It's mainly the corporations and things. That's a bit of a deep dive. But there's a little bit of an issue right now in the industry generally about staffing. And it has a lot to do with commercialization, right? But with me, it's just me. It's my business. It's me right now. I do have some support from another vet who's a friend of mine who would cover for me in some occasions.
Yeah.
The funny thing is she's meant to cover me on holidays, and we end up always going on holiday together.
That's not good planning, is it?
Not good planning, I know.
No.
We need to rethink that. And then we do have an admin assistant who can help with the insurances and things like that. So like I said, anything that can be done within the consult room of a vet clinic, we can do in the ambulance or, in your car. In my car, I come to your house and in the home kind of thing. Yeah.
How does a typical day look for a mobile vet?
Yeah, so again, it's mainly the weekends we're talking about, or my days off. And either I will have had communication from a client, oftentimes sent to me from you lovely people, who said, I've met Rhiannon and she gave me your pamphlet, or I saw your pamphlet on Facebook or Google or whatever, and I'm worried about my pet. Now, it could be for any number of reasons. And so they usually communicate with me ahead of time, but sometimes you'll get my vet is closed. I need to see a pet. I had one today. They normally see another vet, but had an ear infection. They don't want to wait, till tomorrow because it's uncomfortable for that pet. Yeah. So they communicate with me via text, or they call me and I say, yep, let's come on down.
And to be fair, it's probably not convenient for them because they may be at work themselves as well. So,
and that's one of the main things is, and I tell people this all the time is, as a vet, if I weren't working in a vet, I would struggle to take my pets to the vet because I don't have the capacity during the week.
No, of course don't, no.
And so, and I understand how that works.
And most are closed by the time you get home anyway.
And most are
which
closed.
is understandable.
Even though they have extended hours,
it doesn't
my
suit
extended
most-
hours, I'm there for my extended hours. So I have to, so a lot of working professionals, a lot of people who, for whatever reason, can't take their pets to the vet, they themselves have health conditions. I have a lovely client who, with a dog named Archie, lovely, and she herself has health issues, and so she cannot take her pet to the vet. So you get a call, or they probably communicate. That's the best, really. If you know that something is wrong and they want to sort of these more chronic conditions and they want the convenience, then we can set it up. And then on the day, if I have a case that needs a little bit more care. Now, sometimes they will call me and they will say, this is really urgent. I've seen this and this, and I noticed that it's a life-threatening condition. I will tell them, listen, that's not something, I can try to help, but realistically, you should be going to an out-of-hours care because they're going to have the facilities to hospitalize like I won't. Yeah. But I do work with Pennards in Seven Oaks in case something like that happens and they need to take on a life-threatening case. And by law, I have to have somebody to help me cover that, and Pennards in Seven Oaks. And they are also independent, which is the beneficial part of it. Yeah. I try to work with independents as much as is feasibly possible.
Which is nice as well. I think, a lot of people appreciate that now. We're looking more at independent vets,
100%.
aren't they?
Any misconceptions people have about the services you provide?
I think we've joked previously. Sometimes people think I'm a groomer.
Right, okay. What nails?
So they call me for a nail clip, and I kind of say, yeah, and then I said, I'm a vet. Listen, it's nothing bad about groomers, but groomers have done this longer than vets have. So clients, I say, you don't want me clipping your pet. I treated your cat, and I said, listen, I'm going to clip him, but it's not going to look pretty. I'm sorry to say, because we do medical clipping, right? So we don't do things to be pretty. We do what's necessary for the health of the pet. So sometimes you'll get a call for a groomer, and then they're sort of flabbergasted by the price. And I was like, well, it's not really a grooming appointment. I can do it as part of the medical assessment, but and they're kind of like, I'll call you back. I was like,
That's okay. Realised, oops, I've just called the vet.
So going on from that then,
Yeah.
what are the types of cases that are best suited for home visits, apart from nail clipping, obviously?
I'm not going to do nail clipping.
No nail clipping, please.
I will actually caveat that by saying some groomers and some owners will struggle and they need sedation for their pets.
Well,
there
is that.
I can help.
Exactly.
Because I can sedate, and that's one of the things that I can do. So that's one of the misconceptions. Actually, there's some things that I can do as sedated procedures. So while I don't do hospitalizations and while I don't do surgeries, there are some things that I can perform in the van because we have the capability. I have a table, I have equipment. So I have done a cat castration. There is a section of the Royal Veterinary College Code of Conduct that's called Schedule 3, which means you can do surgeries not inside of a body cavity, not with anesthesia, things like that. So basically that category. So if I'm not doing a surgery that requires a general anesthetic, right now because that will come, then I can do that on the van in some circumstances, right? In some circumstances. So that's what I say. So actually, I can do one kind of mass, one kind of lump is called a mast cell tumor, and there's with the innovations that have come from veterinary medicine and what we have to our disposal, I can actually do that on the van sedated. It's a surgery, but as an injection of a particular kind of medication that can help with that particular kind of mass. Not all masses, unfortunately, and not in all parts of the body. So it has to be very specific to that medication, but that's one thing that I can do as a lumpectomy of that particular mass on the van because it's not a general anesthetic.
That's interesting.
Yeah.
So it's quite complicated, really, what you can and what you can't do.
It is a bit. So that's why I say just send me a WhatsApp and we can talk it over. Or I can call you and we can go over it. But but the main ones are exactly what owners would think happens inside of the consult room of a general practice. So we don't overly complicate it. It's your chronic cases of arthritis, of diabetes, of anything that's chronic we can manage. Any acute issues like they walked in the park and they came up lame, things like that. Even some wounds. If it's not too deep, I can deal with those.
Because that's quite a common one, I think, at the minute, isn't it? Dogs getting tangled up in barbed wire.
All the lurches running into the poles and things like that. So as long as it's like a superficial thing and it's not gone into lungs or anything like that, requiring intensive care, I can do stitch up kind of thing because it's not something that's too invasive. I can do a flushing of a wound and things like that. But so exactly what you would think would happen inside of the consultation room without having to be hospitalized or admitted, I can probably do it. And I have little things to help me restrain the animals or what we call chemical restraint sedation for that.
How does seeing pets in their home environment change the clinical picture?
So much.
Yeah.
So much. You would not believe. They're calmer. That's the huge thing, is we talk about this, and we know about it ourselves. I say this to clients all the time. What do we say about the straw that broke the camel's back, right? Stress is a ramp-up thing. You're not going to yell at Andy because he tipped the tea over or whatever. You're going to yell at
I would.
She probably would, though.
Can I just point that out? That is a waste of tea, so
you're going to be frustrated with him or you're going to be frustrated with her throughout the day, and you did one silly thing, and that's what kind of kicked it off. Same thing with pets. So you have to imagine that the stress starts from earlier. First of all, you've interrupted their schedule.
Yeah.
Especially cats have a schedule, but dogs do as well, and all the animals have their own schedule. You've now shoved them into a container, sometimes the cats, or you've shoved them in the car. They're driving. Okay, the dogs might get excited until they realize that you turn the corner to the vets, and they're like, oh no, kind of thing. And if they're big dogs, you have to really shove them in the car. They're like, oh, what is this? I'm too tired. And then they have to sit and wait. And listen, in veterinary practice right now, vets are allotted 15 minutes for everything. And you're going to run late because some cases need longer time, right? And some cases don't.
To be fair, all vets are always running late now, aren't they?
Well, all vets are running late because there's not enough time, and that's part of the problem. So then they're getting stressed because there's other pets that are stressed. The owners are stressed because they're late for work.
And it is infectious.
It is 100% infectious. You can feel it in the room. And I know when I walk outside in the waiting room, when the clients are mad at me that you get the glares, and I get it. They're upset. They have their day planned, but it's hard because you have to give that attention to that patient. Well, I can do that. I don't have to rush in 15 minutes, and I'm one of those vets that notoriously runs late in the consult room because I want to give that time to that patient. So I can give that time in the home. I can let them, they're not getting stressed. The only sort of point of stress is me coming into the home, or I have some clients that actually don't like me coming to their home at all, and they prefer to be on the mobile unit because it's a neutral environment, and they get lots of treats. I always come with treats if they're not allergic to them. So they come down a lot easier. Some of them will guard a little bit, so sometimes they need a little bit more time. We know our friend Marnie. I was with her for an hour. Yes, the consultation is half an hour, but I was just with her for an hour for her to sniff me and just to just to get used to me being there because she needs that time, right? And there are other pets that need that as well. Just me sitting there and for me to give them snacks and for them to sniff me and to realize that I'm not going to do them harm. And those are kind of the cases that the stress really reduces. And then you can see how are they walking? How are they running? How are they acting at home? You know, what is their environment like? That's really important as well, because in a consult room, I don't know what the
You
home
actually
is
see
like.
the other side of it, because
See the other side. Yeah.
that is one thing that when
Yeah.
you take your vet to the consultation room,
Yeah.
the vet doesn't know that.
We don't know that.
In fact, to be fair, the owner probably knows more.
100%. But they
Than-
don't think to
than
tell
vet.
me.
No,
So
no,
owners
of
don't
course
think to
not.
tell
No.
me that their yard is huge
Yeah.
and their dogs are running around like crazy lunatics,
of course
or
not,
their
no.
yard is like a postage stamp and they have no room to run, and I'm telling them rest your dog, and they're like, and I see this all the time. Actually, it's one of my favorite things. Is like you have to put them on a lead, including in your garden, and they're like, really?
Well,
But now I
it's-
can see the garden. I can see how many steps they
Yeah.
have to do.
Or like us,
Yeah.
you know, like we live in a townhouse. We've got stairs.
Yeah, yeah,
Lots
yeah.
of stairs.
Yeah, but
No.
I can see that now
Yeah.
because I have to walk up those stairs,
Yeah.
or even if I'm not going up the stairs, I can at least see
See it,
them.
Yeah.
I can see what kind of bowls
Yeah.
they have. I can see what, you know, maybe I don't know
Yeah.
what kind of food you're giving if
Yeah.
if it's not part of the discussion, but I can see the environment and comment on it before you even think about it, because it's not something you think about. It's your environment,
Yeah.
right? Whereas it's like,
Yeah.
alarm bells. I can a lot of times I can see that they have slippery floors.
Yeah.
And the dogs are slipping about when they have arthritis.
Yeah.
So they don't have to think about it to tell me.
No.
I can see it and I mention it.
No, and it's not
Yeah.
missed.
Yeah, exactly.
Yeah.
So when we talk about stress, I can see a lot of things as a home visit vet, and I have more time to see it as well. I'm not rushing them out the door to see the next client. These are all things that, you know, I have the appropriate amount of
Yeah.
time to go over it. And that's the other part of it. There's time to have the conversations.
Yeah.
There's time for the education. And I think that's where we have an issue right now, is because the vets don't have time and because the clients feel rushed, they don't understand what's happening. And the vets think that they've communicated it, but they haven't because they're rushed.
Yeah.
Yeah.
And then
And everyone's stressed.
and then everyone's
They're
stressed, and then the
stressed.
clients are like,
Yeah.
why have I paid for this? I don't understand.
Yeah.
And they've paid for the oftentimes appropriate treatment.
Yeah.
It's just that they don't understand why they've done it.
Yeah. And I think
Right?
it's quite common, because we do get
Yeah.
a lot of people who come in and say questions, and they say, well, did you not ask?
Hmm.
You know, and they look at you, gone out and say, but did you not ask why?
Yeah, yeah.
Or why that particular choice? Or
Yeah.
the vet said that to you.
Yeah.
It's like, you
Yeah.
don't like to question.
Yeah,
No,
yeah.
but you have to. You
Yeah.
have to. Cat hasn't got a voice, has it?
Yeah.
And quite often you need to ask the question. And I said, don't. The vet's not going to get annoyed with you.
No, never.
You know, because vets probably not
Yeah.
respect, but go, oh, actually, this person's taking real interest in
Yeah.
what we're doing and why we're doing something. I said,
Yeah.
because with children, you would always question, why
Yeah,
are we going to do
exactly.
this?
Exactly.
I said, there's no
Exactly.
difference. I said, they are human.
We are human.
Yeah.
And you also have to understand that we see cases like this a lot. So we're all very sort of, you know, autistic,
Yeah.
type A. I mean,
Yeah.
we've had to do a lot of studying to get into
Yeah.
this field,
Yeah.
right? So a lot of us, because we see it so often, we also make the mistake of assuming people know what we're talking
Yeah.
about.
Yeah.
And sometimes people are not along,
Yeah.
and you think that they've understood it. You know, I personally say, I've said a lot of things to you. What do you, you have to say?
Yeah.
You know,
Yeah.
but some vets don't have that experience yet. A
No.
lot of them are young too.
Yeah.
They don't have that experience yet, and they're learning
Yeah.
and as they go. You know,
It is quite an academic thing to be a vet, isn't
Yeah,
it?
yeah, there's a lot
It's
of
not
studying.
necessarily a people thing to a certain degree.
Yeah, I mean, this is kind of the thing is like all of us have been really studious, and we've had to be in order to
Yeah.
become vets. Some of us, you know, were also social in our
yeah,
lives,
yeah.
so we learned
Some
how to be
people are more
social.
social than
but
others.
some
Yeah.
people weren't.
Yeah.
Yeah, we've all had to go through quite a lot of schooling, and some people really hit the books hard, but they didn't socialize much. But that's true for a lot of professions, right?
It
It's
is,
true for
yeah.
doctors
Absolutely.
and lawyers and
No, it's
just
you know
true,
people
yeah.
who have odd. So they don't understand the vets. If you don't ask them the question that you don't understand, they are
Yeah.
more than happy to tell you,
Yeah,
because
absolutely.
they assume if you say yes, I get it, they assume that you get it.
Yeah.
And so I at least can kind of be in the house and say, you know, do you
Yeah.
get it? This is
Yeah.
I'm going to give you the entire spiel whether you like it or not, because I know that a lot of
Yeah.
people don't.
Yeah.
You're going to miss about 90% of it. And then I'll send you a summary afterwards, which is the other thing I do. I use some tools which are now available to transcribe what I'm doing, my notes, and then put them into a summary form.
Yeah.
I review that and I send that off afterwards.
That's really
Oh, it's a
good,
great
yeah.
idea.
Yeah. So clients can have it written down, because I know
Yeah.
They've forgotten.
A, I talk a lot, and B, I talk fast. So they're going to miss 90% of what I say.
Yeah, but there is
Yeah.
a lot of information to take on board
There is
sometimes.
a lot. There's
yeah.
a lot of, even in something as simple as an itchy ear is
Yeah.
not simple.
No.
It's very complex, actually, and people don't understand that. And so giving them a summary, is a little bit easier for them. Yeah. And this is where another thing is, like, the rechecks are really important, because then you can follow through with the cases, because, again, it might just be an itchy ear once, fine, great. But if it's an allergy, that's something that needs to be followed. If it's a chronic thing, that needs to be followed up with. Yeah.
Quite interesting.
I do love my job, I told you.
Yeah. We know you love your job. We do. You're always happy and smiling. I have to say, I think you are the only vet I know that is really always happy and smiling. Would you agree with me?
I would agree.
I would
agree with that, actually.
Yeah, I think that's why people are always asking you questions, because you're always smiling.
I think I'm always happy
You need to get the game face going. Now ask me a question.
It's hard for me to do that.
Yeah, but it's nicer that you are like that, because I think
Thank you.
people find that a lot easier.
Yeah.
I think quite a lot of people feel maybe it's not stupid, but a little bit, that when they're asking questions, I don't know what the right words are, but you know what I mean. They don't like to ask questions because they don't want to come across as being stupid, or it comes out completely wrong and they're questioning. Yeah. That's probably the best way of saying it. They're actually questioning the vet. Why? And
I know, but it's like a lot of what we do. We always tell people there's no such thing as a stupid question.
Exactly.
No,
which is not.
No,
exactly. It's not.
Exactly.
Never.
And I will confidently say that the majority of vets out there, and I have I've been in this profession a long time. They want you to do what's right for your pet. We may get there differently. And all vets are going to get there a little bit differently as well. We don't always approach the same problem in the same way. No. That's okay, though. But ultimately, all of us are there for the best of your pet. We also have to consider there's a huge movement now in what's called practical care, for making sure that it's practical for the owners as well. We've kind of done 180, as opposed to going like the best. What's the best for you, right? And so that's a lot of what I do as well, is trying to understand, yes, what's best for the pet, but also what is practical. Because if you can't give those medications, there's no point in giving them, and you're going to feel guilty and you're going to get upset that you've wasted all that money on medications. And yes, there's going to be times when I'm going to give medications that I want the owner to give, and they later find out that they can't give them. Okay, well, let's regroup. What else can we do? It is a lot of, it's not kind of one size fits all. Here, take this pill, be done with it. I think that's one of the things that frustrates people, is there's no magic bullet. Is a lot of trial and error for that particular pet. Yeah.
Well, I think because they can't talk, they can't tell you, can they, how things are working. So that's why
they tell us in different ways, right? You have to read it. It's sometimes, not always, but So
I mean, obviously behaviour and things like that, don't they? But I mean, but some dogs are just naturally happy all the time, regardless of whether they're ill.
Yeah, they are. Yeah, or very stoic.
Yes, absolutely. So right, so many pets find clinics visit stressful. Yeah. So behavioural wise, I mean, what's the huge differences that you would see treating them at home or whether you were in clinic?
Yeah, I think we touched on this a little bit earlier. I think a lot of it, so I mean, the cats, really huge difference. Again, because they have to be shoved in that container. Some cats can do okay, but you get some of these cats that are just really super stressed, because again, we talked about that ramp up of stress. But dogs as well. You have dogs that are just very nervous.
Quite a lot of dogs don't like the car as well. I mean,
quite a lot of
been taken out
car. But again, you have that ramp up of stress for some dogs, and even if they're the most happy-go-lucky dog in the world, everyone has a limit, right? Even us people have a limit, and some pets have a very low tolerance and they will snap like that, and some pets have a very high tolerance, and it depends on also what you're doing, right? If you're just sitting there doing like a little physical exam and giving them treats all the time, then some pets will be fine. But I had a dog the other day, I was just doing a clinical exam, and that dog was really, really nervous. The owner didn't quite understand they'd just been adopted, and he lashed out and he bit me. So this doesn't happen very often. No. It doesn't happen very often at all. But if I see that in the house, there are going to be some pets that you really have to take your time. And sometimes you have to use medications, different kinds of medications, maybe pills, maybe injections, maybe you don't have to use medications at all. Maybe I don't have to take a temperature on that pet that particular day.
No.
Do you know what I mean?
Yeah.
So you kind of have to feel it out for that particular pet. This is why AI is never going to take my job, because no AI is going to be able to tell.
They're not.
AI can transcribe my notes, but they're never going to be able to tell. The difference between one pet. That's experience right there.
Absolutely.
And there's some people that are better at it than I am. There's some people that are still learning. But really, as much as you reduce that stress, and then there's a lot of evidence about cytokines being reduced and the chemistry of the chemistry of stress and how it doesn't allow them to heal and things like that. So the more we reduce stress, and we know this from humans as well, the better it is for the health of the pet, whether it's acute. And we also know this as if we cause stress once, while we all know that pets don't have a memory and they live in the moment, we also know that if we treat them in a way that is very stressful for them, their tolerance for stress reduces the next time and the next time and the next time. And then you can create a pet, 5 visits down the row that is now become a biting pet. So you have to be quite careful, and things like training and things like that come into play.
So the consensual training is something that really, really interests you.
Yeah, it does. Yeah. There is a movement in the US called Fear Free. We don't have that so much here, but we have movements called the Feline Friendly.
Yeah.
And that's mainly in clinic, but I am, I ascribe to feline friendly techniques. We're not accredited yet because we haven't gone through accreditation process, quite a process, but I have been accredited in my previous practices. So we follow those techniques. Yeah. There's a canine friendly. And so yes, consensual training is something that it would be part of that as well. Yeah. Because if they're doing it of their own volition and they're not stressed, and their pets are sentient beings, if they're part of that process, and they know that there's nothing bad going to happen, then
it's quite amazing to see, actually. When
it makes your life easier as well.
It makes my life much easier. There is a video going around of a pet somewhere in Eastern Europe that the owner just says, sit there, and they take bloods, and the dog is sitting there like this, and you're like, and all of us, it was going around the vet channels, and we're like, oh, we really wish that.
It is amazing. I must admit, when Louise showed us, I've seen her dog. She's been in the shop with her boxer, and her boxer just puts her head there, and it's like, oh my god,
I would love that. I would love to see that.
Amazing, but so, are there any categories of patients that would you say? I know we talked about different things, but obviously cats. What other animals other than, because we know dogs, some dogs. What about other small animals that? Yeah, I mean, so again, we talk about different kinds. So all pets can benefit from a home visit because of that stress component. I think it also, a lot of different owners can benefit from it. I don't think about it as much as species. I mean, the benefit of small animal is you think of animals individually. So I don't think of them in terms of all cats or, reptiles and birds certainly, and things. I don't do a lot of reptiles and birds. I'm not an exotics vet. That's one thing that I do have to say. I can do probably the basics on those guys, but I'm not an exotics vet, but I can do the basics. Small furries. I mean, does your hamster really want to sit in their cage running around in the car while they're waiting for us while dogs are barking and cats are hissing next to it? Probably not. Because they're a prey animal and they're probably scared out of their little minds. So I think those could benefit. But people as well. We talked about professionals, working families, mothers who are running around, driving their kids here, there, and everywhere, and they have no time. And the benefit with me coming to the home is that they can cook the meals, they can watch TV with the family, they can have a chat with the family, and even if I'm a little bit late because the other one was late or traffic, they're at home and they can do all the things that they wanted to do, which is a little bit of a benefit. People with health concerns, seniors or people with health issues that can't get their pets to the vet easily, it's beneficial for them a lot of times. Again, I have one client who's absolutely lovely and amazing, and that's exactly why she called me. And again, nervous dogs, nervous cats, cats that really struggle to get in the carrier. Lots of dogs. I mean, if you have 5 dogs, do you know what I mean? That's a lot.
Wouldn't you rather me come out and do them all in one go rather than you shove them in the car? And then they're all stuck in one room. I've had them, and they're kind of causing havoc and barking. So so it depends very much on the owners knowing their pets and what they can do and what's within their wheelhouse to do. You talk about
building lasting relationships with families.
Yeah.
What does that mean in practice?
So I think what people want in life, right? And they see it with you guys because they come to you and they say, Ryan, you know, and they trust you, and that's what it is. It's building relationships is about trust. And again, we talked a little bit about the veterinary industry and seeing different vets come and go, and you don't have time to build that trust. You like a vet and then they're gone, right? And so it's about building the trust, about the continued communication, it's about the consistent communication. Because if I'm seeing one pet, I'm going to be pretty consistent with what I say, and I pretty much know what I said the last time, even though each pet is a bit different, and I have my notes to remind me. But the client sees you again, and you build on that conversation. You build on the trust, right? And they might trust vets in general as a profession, but it's one thing to trust us, but your pet is still really unwell, and then see another person, they tell you something completely different. You lose trust. You lose. I would, and you would.
And as you said before, that all vets they get to the same end game, but they may get there differently.
They may get there completely differently.
Yeah.
And vets, notoriously will have conversations in the back of the building, and we'll have a lot of clinical conversations. This is one of the reasons why I'm still in practice part of the week, is because I still have that camaraderie of being able to have conversations and bring up cases with other colleagues who can help me. But again, we approach every pet their own way. We want to tailor the care for them, but what does that mean? If I'm telling them one thing one day and another vet's telling them another thing another day, and then the third vet's, that's really frustrating for clients. And that's
and you do lose trust there.
And you lose trust, but you also get frustrated that you've lost your money.
Yeah.
And this is again where part of that conversation comes, that it's not about us trying to do anything bad or good or whatever. It's just we're trying to come to the same place, but we're all getting there a little bit differently. So if it's stop and start treatment, and so that's the thing is how are we doing it, giving clients the time, giving them the space, giving them the consistency to build that trust over time.
So chronic pain management, one of your focus areas, I know that. Why is this so important to you then?
So I really got into it. I remember the case, actually. It was an old German Shepherd, not that old actually, middle age, and we had to euthanize him. And I knew we could do more, but that dog was in so much pain that I just felt really bad about that euthanasia. And the client, the owner, the pet owner, the dad, felt really horrible about having to euthanize him. And that's sort of what got me down that rabbit hole of trying to do better. And that whole area has evolved a lot. And we're trying to educate clients about getting on board with things sooner. We really don't say anymore, give this medication as and when, and we really shouldn't be saying that anymore if vets are still saying that, because, we talk about a chronic management of disease, and it's a very complex process, and we didn't really appreciate it before, and there's more and more research being done about it now. And actually they found, I don't remember the numbers off the top of my head, but I think they found some signs of arthritis in some dogs as young as, 16 months old. Interesting.
It is, isn't it? It's young, isn't it?
Yeah. I can't remember the exact, was it 16 or 19 months old, but it's very young, very young. And so we really need to be acting sooner to allow these pets to have a quality of life. Now, I don't do any x-rays on my van because they have to be anesthetized for that. Hopefully we will be changing it to have conscious x-rays at some point. But there are some things that we can do, and we look at, again, this practical care about quality of life and how do we maintain that quality of life, and we look at a very holistic approach. Right? We look at, the medications are not going to fix that pet. The medications are going to allow that pet to feel better, to have less inflammation, to then be able to do the exercises to build the muscle, to then be able to eat the food that they want to eat, to be able to live a quality of life they want to eat. The medicine isn't the cure. The lifestyle and continuing that mobility is the cure, right? And realistically, how I got into it was I just was sad seeing all of these pets dying prematurely from things that we could have managed. Had we started sooner, How do we started at the beginning when things were starting to become painful? And this is where I kind of jump on and tell clients, hey, that pet, we got a little bit of pain there, or that, pet owners sometimes don't see it because you've kind of gotten used to them having a little skip in their step or a little stiffness in their back. And so that's where me as an independent can see them walking,
a set of fresh eyes.
A set of fresh eyes. Yeah. Say, we got a little pain there, and doing a little palpation and saying, right, we got a little pain here and here and here. Can we start something?
Yeah.
And people sometimes are really hesitant because they don't they think they know their dogs very well.
Yeah.
They've just gotten used to seeing it over time, and this is true for my pet as well. You kind of get used to something. You're like, shoot, I have to give them something. I have to give them medication. Yeah. But I'm as guilty of it as anybody.
Oh yeah, I think we all are, aren't we, to a certain degree?
Yeah. So that's why it's just about quality of life. And I think that's the same is true for the pet parents. They want them to have a quality of life. It's just that I'm noticing something from an independent point of view that they're not noticing.
So what are some signs of pain do you think that people do overlook?
Yeah.
What would be some indication?
So the biggest thing is my pet is getting old. That's the first thing. When I hear them say that is a red flag in my brain. Because it's the classic, they're slowing down, they're sleeping more, they don't want to do as much. Yep. That's the first sign. And a lot of people associate them not limping or them not yelping as not being in pain. Yeah. But actually, it's the in-between times. Yeah. That's the problem. They may have run a mile. They may have been chasing the ball on the beach for 10 hours, But what are they doing afterwards? Yeah. They may be on their 2-hour walk in the woods, which is fantastic, because they have that adrenaline. They're keen to do it. They want to do it. Yeah. It's exciting for them.
Exactly. Yeah.
But are they having difficulty getting up in the morning afterwards? For cats, are they not jumping as much? Yeah. Right? Or are they stopping more? Cats is a lot more difficult. Owners of dogs have become a lot more aware now. Yeah. The owners of cats are still struggling because they naturally sleep a lot.
And they have staff cats, that's why.
Yeah, they have cats,
So, cats are cats, aren't they?
So you'll see this comment, my cat is getting old, my dog is getting old, my enter the type of animal you have is getting old. And typically that's my first sign that there's some discomfort or pain. Yeah. And then I'll do my clinical examination and I'll feel. But the frustrating thing is some of these stoic dogs, that there's something going on because I can see them walking. Yeah. Yeah. And I can see, and that's the nice thing about being in a home as well, because I can see them walking in their natural environment or upstairs or downstairs or running. And that's really good because I don't often see that in a clinic. No, they'll be
dragging on their lead.
Yeah, because they may walk normally, but on a run, you can see them get a hitch. Yeah. And that's really important, actually. So being able to see that and saying, this, and then those stoic dogs are sitting there going, I'm not going to respond. You can't touch me. You're like, oh, man. So then you do these drug trials. You do a trial of anti-inflammatories or something like that. Interestingly, a lot of people say, oh, try this for a week. But actually now the research is showing that you need 2 to 3 weeks of anti-inflammatories for a good response, right? Okay. Before you see it. So I always tell people if they can video it or things like that. Yeah. I worked with Canine Arthritis Management for a while, and they are a fantastic resource for arthritis. Obviously, the name is Canine Arthritis Management, so they focus on dogs, but the theories apply to cats and other pets as well. It's just that the other pets, being prey animals, will hide it a lot better than a dog who's a pack animal. Yeah. Yeah, because they have the protection of the pack in the wild, right?
Yeah. So how has our understanding of osteoarthritis changed in recent years, do you think, then?
Yeah, I think a lot of people considered it then an old dog disease and really wouldn't address it until they were sort of at the end, and then we'll give a little bit, had a bad day, we'll give them a little Medicam kind of thing. Whereas now I think people are becoming more aware, even though they're not there at the early. There's some clients that are actually. There's some clients that by themselves will get the supplements. There's some clients that by themselves will do the hydro. And that's fine, especially if they know they have breeds that are predisposed to things like hip dysplasia or, knee cruciate injuries and things like that, which, if anyone doesn't know, it's an ACL. It's a ligament issue in dogs that people don't have necessarily. So people are a lot more aware of their dogs. People see their dogs anyway as part of the family. So they're with their dogs. They pay attention to their dogs more than they used to, right? Yeah. The nature of the pet has changed, and so the nature of the medicine has changed. Right.
And what practical steps can owners take to improve the quality of their dog's life, do you think?
Oh gosh. Well, we talk about, what you need to be doing for your pet.
Yeah.
You need to be feeding them appropriately. Well, you need to shelter them, feed them, make sure they have a comfortable places in, not suffering, right? So those are the responsibilities, the legal responsibilities of being a pet owner. So within that is, what does suffering look like?
Yeah.
Again, being a little bit more aware. Clients and patients owners are a little bit more aware of what's going on with their dogs. So being a little bit more aware, what is not normal for my pet, right? And I think that's the thing, is as they get older, when they're 2 and 3 years old, you can kind of tell. That's what the prime of their life for most of them. If they've hit themselves or if they've got an ear infection or whatever, you can kind of tell. But they should be running around pretty carefree and fancy free. They're in their 20s for 20s and 30s. And then as they get older, you should be noticing what's happening. Are they drinking more? Are they, so basically the main thing is, what is normal for your pet? How much do they generally drink in a day? How much do they generally wee in a day? How much do they? What does their poop?
Just something out of the ordinary, really looking for.
So then when we talk about medicine, we talk as vets about trends on time. So what's the difference? So your dog is going to be, if you have a Labrador, I know that your Labrador is probably going to eat a lot of food. So what is the change? Have they stopped eating? Well, that's a concern.
That's unusual.
That's unusual, right? Or are they a very picky dog that all of a sudden is eating a ton of food, or cat, or all of a sudden they're eating and drinking a lot. So it's mainly, if we want to really understand quality of life, know what's normal for them in the prime of their life, and then start noticing the changes as they get older. And that's just being a pet owner, isn't it? And videos are wonderful now. You take a video. If you're worried about it, take a video. What was a video of them back when they were running around when they were 3 years old? Show me a video now. What's the difference?
What's the difference?
That's the easiest thing I think that owners can do, is just tell us what the difference is. And, when did that happen? The main thing is also, when did it happen? Has it been now? Did it happen yesterday, or did it happen a year ago?
So the communication is quite important from the other side as well, not just from the vets. So obviously people need to communicate more clearly, like you say, videos and that kind of stuff.
Without a clear history, vets have a running dialogue of what things could be wrong in our brains any given second. Like I literally have a list every time I see a pet of what could be wrong, and the history and what has been going wrong from the owner can help me take some things out, so that it helps me target what I'm going to do with that pet. Does it mean I have to do just a couple meds, or does it mean I have to do a lot of diagnostics to figure this out, kind of thing?
Right. End of life care. One of the most difficult parts of veterinary medicine is helping families through end-of-life decisions. Absolutely. How do you approach those conversations?
It is a hard thing. It's a hard thing for all of us. Just like every pet is different, every family is different. And it is a privilege for pets to be in our life, but we know that their lives are not as long as ours. So at some point, all of us are going to have to make
we set ourselves up for it, don't we?
We set ourselves up for that.
So many times.
Little kitten, we don't think, do we? 8, 10,
think,
whatever. We're going to be.
Well, unless you're buying parrots. That's a whole different conversation. But so at some point we're gonna have to make that decision, sooner or later. First of all, being able to do it at home in their personal surroundings.
I think it's fantastic.
With their family there, is a privilege, because again, we talk about that stress, but also, a lot of times family can't all come and be in that little consult room. It's less sterile. They're in the family home where they are loved and they have their own smells. Sometimes their own, the other pets in the household, the families let them come and sniff. As long as they're not like where I am working.
It's quite important for the other pets sometimes to see that happen as well. They do grieve.
They do suffer afterwards as
well.
They
can. It depends on, it depends on their relationship, and every pet is different and they mourn differently, right? So it's a hard thing to come to terms with. And again, we talk about quality of life, and it really is about, where is their quality of life compared to, what it was. And we're not talking about normal. We're talking about just quality of life. Can they be themselves? Are they suffering? And what degree? Some degree of suffering we can help with pain medication, with what do they have? But also, what's the limit of the owners, right? We have, cases of diabetes. Diabetes is a manageable disease, but it's also very devastating. We know this from humans, right?
Yeah.
If we have an owner who is on it and can give the injections every day, twice a day, and get on the food and be there. If there's any complications, bring them right to the clinic. Well, maybe we can manage that longer, and then only when it sort of becomes really devastating is it that pet's time to go. But what if we have an owner who themselves is very sick, or they have really bad arthritis in their hands and can't manage the syringes? They love that cat or their dog or whatever, but they themselves will struggle to give the medication. Do we want to let that pet suffer? Do we want, maybe they're not suffering now, but they will, because there are certain things that come with diabetes that can be life-threatening. Yeah. So do we give them some time and then let them go, right? Mm-hmm. And that point comes at a different time. And some people need time to say goodbye. I certainly did when my cat died. Some people are ready to let go a little bit sooner. Yeah. And it's also about understanding the people. But sometimes as a vet, we try not to intervene to say, listen, it's time, you have to do it now.
Yeah. I think a lot of people look for that, though, don't they?
A lot of people want to.
They don't want to make the decision.
Some people need that little.
Need somebody.
Some people need that little push. So every vet's a little different. Yeah. Every vet, I know vets will say, you know what, you should put them to sleep because they're going to suffer. And they will I know some vets, myself, I try not to intervene until I know that pet really is suffering too much on balance, and we're not really helping them, and we should, and that's when I'm going to start.
We can be quite selfish, do it for the wrong reasons.
Yes.
We love
the things we love, and we don't want to lose the things we love.
And unfortunately, it's one of the hardest decisions we have to make, but it's also the kindest decision, and I think we forget that sometimes, don't we, as well?
I see it both sides, actually. I see some cases that can be managed. For instance, hypothyroidism in cats can be managed in most cases with medication, but some people just don't understand it. They don't get their head around it, and they say, no, I don't want to let him go. And then another client will want to drag it out, and you know that pet's up. So those are the conversations you're having with them and saying, what can you do? This case can be managed if we give them X, Y, Z. Can you do it? Yes or no? Okay, well. Yeah. Or, you know what, we've done everything we can do. It's time to go. If a pet, for me, is actively dying in front of me, then I will step in and say, listen, we really have to do this now. Yeah. But again, that's a different approach for different vets. Everyone does it a little bit differently. Another question I get asked a lot is, what would you do if it was your pet?
I can imagine.
I get that asked a lot, and I really struggled with that question for a long time.
It's a hard one to answer.
And I've kind of come to the conclusion. This will evolve over time, I'm sure, but I've kind of come to the conclusion is just like everyone is different in the way that they can care for their pets, the same is true for vets. Yeah. What is true for me and my lifestyle and me being a vet and what I have access to or don't have access to, that family might not. Yeah. Or may have that in abundance. I'm a single woman, and I'm a working professional, so I'm time poor. Yeah. But I have access to veterinary resources that many families won't. Yeah, that's true. Yeah. So if you ask me to give my dog a pill 3 times a day,
you could do it.
I won't be able to do it. But they might have 5 people in their household, and somebody's going to be able to give that dog a pill.
Absolutely same.
Right?
The third time. Yeah.
So the question is a loaded one, because every vet is going to have a different answer to that as well, because they themselves will have a different point for their own pets at which they will throw in the towel. So that's a very difficult question, and people ask me all the time, and I try not to answer it, or I give them that answer, because it's very individual. But I try to help them through the process. Yeah. I try to help them through that grief and that understanding, and it's a difficult one. Yeah.
What's the advantages of doing it at home as such?
I mean, I think we said it is just being in the home environment. Yeah. It's harder for me, to be honest, because it's not a prepared area. I have to kind of adjust to the household, but that's better for the pets, and that's better for the family, because they are there in their home environment where that pet has been sleeping every day, and has their own smells. It's their own bed, and they can gather around their pet and be with him as they pass. And some people can't handle that, and they step out and they go outside in the garden. But that's okay, that's okay. And it is a pleasure to give relief to families. It's not a pleasure to do it, but it's a pleasure to give relief to those families.
So, what do you wish more pet owners understood about the quality of life assessments?
Yeah. Yeah, it's a hard question. Because just like we said, every family is different. Every pet is different. I have debated, there are these worksheets, kind of these tick lists, and I've debated whether to put them on the website or not. Some people need them.
Yeah.
Some people need an answer. Some people need somebody to kind of tell them it's time.
Yeah, I mean,
I've actually heard people to come in the shop and talk about these assessments.
Yeah.
And I often wondered what they were.
I suppose some people, because of the way they are as well, and maybe because of the industry that they work in themselves, and they actually need that.
Yeah.
It's not.
Some people are very cut and dry, and they want kind of a tick list to kind of say,
almost
okay, pros and cons.
unemotionally connected. Yeah.
Well, I think they want to take the emotion out of it.
Yeah.
And I think some people, it's a very emotional decision, right? Because it's your baby. You don't want to let them go. They're part of your life. Yeah. You're mourning a life without them being there, just like a human. Because they are part of our lives. They are our babies now, aren't they? Yeah. I mean, mine are. So I have debated those tick lists, and they're very good for the people they work for. I prefer a conversation. I prefer to have that conversation, because then I can kind of understand where that owner is coming from. And how much, I mean, all of our pets mean something to us, but how much that owner is going to suffer when that pet goes. And not to mean that all of our pets, we don't suffer when they go, but some people are really dependent on their pets.
So an elderly person, that's the only a company that they do have, maybe their family's farther away.
Absolutely.
Is not that makes it any more important than anyone else, but they perhaps, that is their life. That's all they've got.
That's exactly the example that I was thinking of. As an elderly person, it's their companionship. Homeless people as well. That's their companionship. That pet has gotten them through addiction or whatever. There are lots of categories of people that need to work through it before the actual event, if that's possible. In some cases, that's not possible. So like I said, I debate those. They're very good. Yeah. They're studied scientifically.
They have their place, I suppose.
They have their place, absolutely. But that's why I prefer, and that's exactly part of what I do. It's a bespoke service. It's a human touch service. It's not a tick list exercise, what I do, and nor do I want it to be. No. This is what I love, and I think
impersonal as well if you become so focused on ticking boxes.
Some people like impersonal though.
But some people do.
Some people like impersonal.
Yeah,
though,
I know. I worked with the very beginning of my career, a very old Scottish gentleman, and he would just say, "Right, it's time to do it. We're gonna," and some people responded to that.
Yeah.
But I notice some people, and I see it especially with couples and families, that one person is there and the other person isn't there, and sometimes I have to pipe up and say, maybe we'll do it tomorrow to give this person.
That's normally yours, isn't it?
Yeah.
That's normally yours. I'm normally the one that goes, time isn't off, and you're...
Yeah.
It is.
I'm a little bit more emotionally attached.
Not that I am, but I just have to go, right, okay.
But you have that medical background, though.
Yeah, that's the thing. And I go, no, it is time, and then you just need a little bit more time to process it, don't you?
I do.
Even though I sort of try and prepare and say, look, this,
but
we
again,
booked the appointment 7 months in advance.
Yeah. But again, that's where the conversation is important, because you might be there, but Andy might need more information to get there.
Yeah.
And so having that, you don't get that from a tick box.
No, it's true.
You get that from a conversation, because sometimes, and I won't always know what information that it is that will tick them over, but me just discussing it. Yeah. I had one very recently, not in the mobile, but in the practice that I'm working in, and the pet was very ill, stage 4 kidney failure, very, very ill, and it was a couple, and one person in the couple was like, right, we're not going to let them suffer anymore. I mean, the pet had been very uncomfortable for a very long time, and they were really not wanting to see that side of it. And one person was there and said, right, we're going to do it. And the other person, was not there at all. And it was hard to deal with. And you have to just talk them over. What's going to happen? What can happen? What is the pet going through right now? What medication do we have to give? Blah, blah, blah. And it's sometimes the most innocuous things that I'm going to say. Yeah. Sometimes just the practicalities of all the medications they're going to have to give, that they're still not going to get better, even though we're going to have to shove 10 tablets down their throat. And they're like, oh, actually, this isn't going to work. Right. So, I think another one that people look for is if they're not eating and drinking.
Yeah.
I think when they stop eating, then I'll stop. Labradors are not going to stop eating.
No,
Unless,
some dogs just continue to eat right until the end.
And this
don't
particular
they?
case was the same way. It continued to eat, but it was suffering in other ways. So I think it very much is. It should be a conversation with yourself as a family. What is going on with your pet and your vet, because they have that knowledge to tell you, listen, this isn't looking so great. This is not a good prognosis. And we won't euthanize pets that we think will survive, right? There's no reason for us to do that. We want you to have your pet for as long as you need your pet. Our job is really there to prevent suffering and to give them the best healthy life that they can. That's the owner's job as well, but it's not their job, it's my job. And I have that impartial view of it, right? So that's about quality of life is, kind of how do we get there? Yeah.
It's a difficult one, isn't it?
It is. It's a difficult conversation.
Because everyone's quality of life expectations are different as well, aren't they, unfortunately?
That's exactly it.
And how do you personally cope with the emotional side?
Of euthanasia specifically?
Yeah.
So, yes, I've cried during some euthanasias, and I've not been happy, but I've been in a position where I have felt relief that pet has stopped suffering.
Probably,
because I've seen them go through some suffering. I think it depends. I think the ones that are suffering, we are all, as a veterinary industry, very resolved to say, this is part of our job. This is part of our job, and we're doing it well, and we're giving that pet the best life it is. The ones that are hard are the ones that you've been dealing with for a long time, and you've done everything possible, and it just doesn't work. And you're like, I wish this didn't happen. Like some of the cancer ones, or some of the ones that and the ones that are really
quite
difficult.
Invested in it.
Yeah, because we get invested in those pets as well. We research at home. We take our own time on the weekends and on the evenings, looking things up and talking to our colleagues about your pets. We're very invested in some of our cases. And when you really struggle and you're really trying to find everything and they don't make it, that's where I've broken down as well with the owners.
It becomes a personal.
It becomes they become part of you as well. They become part of your story. And the ones where you could do more. That's where we really struggle. We struggle with clients who struggle financially as well, because we know we can do more. We want to do more, but there are realities. It's beyond. Those are the ones that we really struggle with. They're the ones that we think we can do more for, but we don't have the opportunity to do it. But in general, I think a lot of the public think that that's the reason why we have issues with mental health in our profession and whatnot. That's not it. No. That's not the reason. We have other problems in the veterinary profession that are causing the burnout and the mental health crisis. A lot of what's happening now with the industry and the commercial side of it is causing that stress more so than the euthanasias. The euthanasia stress is a very tiny part.
I mean, doctors obviously don't. Human doctors don't euthanize, but obviously they see death. It's the actual sin of the death, isn't it?
They're not actually. I mean, and if you look at it from some like the other medical side, like as a nurse, I witness people, suffering and dying very, very painful deaths. But you guys can actually prevent that. You can help.
We can help
that, and I think that is so important. And a lot of people don't witness these different sides to how, whether it be human, dogs, cats, horses, whatever.
Again, that's a privilege that we have that people don't have, and people do comment. People don't comment on it.
We wouldn't, I mean, we treat our animals better than we do humans. I personally think a lot, especially in this scenario, end of life. It's definitely very. And thank God that we do, because they can't tell us how they're feeling, can they? And they can't tell us when they've had enough. We have to make that decision with.
I kind of understand why we don't yet.
Yes.
Because again, that vast difference of I don't have money, therefore I'm going to put my pet down is very different than doing that for a human being.
Absolutely.
So I kind of get it, but
so you're safe at the moment, Andy, because you don't have that.
On video.
Right. It's all right. I said we don't have that, so you're safe. I have a witness.
Ship them off to Switzerland. No, so I think one of the things is what's frustrating to some clients is that sometimes we don't have the not we as a veterinary professional we have resources, but sometimes there are not resources available to get a diagnosis, for instance, whereas humans will almost get a diagnosis no matter what. Barring a UTI, for some reason everything's diagnosed as a UTI in human medicine.
It is, I don't know. Everything's described.
So we don't always get to a diagnosis, but sometimes we don't have to. If the pet's doing okay and the thing that is done, giving the symptoms is done, like a tummy bug, we don't have to get a diagnosis. No. Whereas sometimes in human medicine, they sometimes do, not always. Yeah. But in terms of euthanasia, sometimes we don't know what it is. Sometimes they're just too poorly, and we have to accept the fact that that pet is doing too poorly for us to put it through. Sometimes we want to. Sometimes I'll tell them that. Vets will always give options. And we'll say, so oftentimes I'll be in a room with the clients and say, listen, we have 3 options. We have, or 4 options. We have the gold standard, the best of the best. This is what, and we can find out everything or whatever, and we do these tests, but we'll know everything, and that's as much as we can do. The next step down is, okay, we'll have to sacrifice some of these tests, but the risk is these. If I don't do this blood test, I'm not going to know this, this, and this, right? So then I'm guessing. Yeah. That's the middle ground. There might be 1 or 2 of those depending on the case, and then the last one is, okay, we'll throw some medicine at it and see what sticks, kind of thing. In some cases, that works really well. Yeah. And every case is very different, right? So, but you always have those choices. And then the last option is what I always say is the last option, right? That option is always there. An owner can come in to me and tell me, I want to euthanize my dog right here and right now because, it's barking too much. That is an option. Whether I do that or whether that's an appropriate option is not necessarily something that we would carry out. Yeah. But you know what I mean? So
anyone can walk in.
Right. Anyone can literally do that. So there are always those options on the table. It's finding the right one for that family and for that pet in that situation. In some situations, you will have an emergency, and we see it all the time in emergencies where the middle option really isn't an option. That middle sort of, we can't do tests like pets in cardiac failure. Yeah. You either have to go all in and put them on oxygen, get them in the hospital, put them on the drugs, let them set all those things, or it's the end of life. Because the middle option is causing too much suffering. Yeah. So the pet takes that out of the equation for us, or the health of the pet, the situation. So that's where it can become stressful for owners, is when they don't have the option that they want, and they don't have the ability to carry out the one that they want, so then they have to choose the euthanasia, and that's the hard one. That's really hard, especially in emergencies. Yeah,
it's not nice, is it?
It's not nice, no.
Is there anything you would say to I would just ask anything you would say to people out there that perhaps have a dog in that situation or an animal in that situation, they're getting towards that. Is there anything you would say to them as a vet now, just to think about going forward?
Yeah. I mean, I think definitely have communications with your vets. Find a vet you trust to have those communications with, because you need somebody to walk you through that process that is trustworthy. Yeah. I mean, it's a major life decision to lose a loved one.
Oh, it is.
And it's a major life decision to be the one to say that you want to let them go. And that's really what you have to do. You have to do that. We have to get consent for anything we do. Yep. So at some point you have to sign that form. And you have to be comfortable enough to know that that pet is in a position. Unless, again, they're dying in front of you, in which case we can step in. But that's not a nice position to be in. That by the time they get to that point, they've already suffered too much. Yeah. So you need to have that conversation with your family, because everyone has to be sort of at least aware of what's happening. The people who are involved in that dog's or pet's life, and it should be a conversation with the vet. And usually there'll be hints. Yeah. If a vet thinks that it's coming, they'll drop some hints. They'll be like, we should start talking about quality of life. What do you think about your pet's quality of life? Either we're looking to give medication to help that pet, or we're looking to have the conversation about end-of-life care. Yeah. But again, we start those conversations earlier, and we drop the hints earlier to kind of put the seed in the head. Because sometimes people just don't think about it. No. Yeah.
So just a quick question on breeds, right? Just talk to us about breeds and all the different breeds out there now. What advice would you give to pet owners looking to purchase? Not necessarily which breed. I'm not asking. So I'm not asking you to put your hands up and say you could only have this breed, but
please research the breed for your pet. If you are living in a very hot environment, please do not get an Arctic dog. If you need to have quiet in your life, please don't get a barky dog. Do you know what I mean? Yeah. Like, we have these very popular breeds and people fall in love with them because they see their neighbors getting them. And all dogs are lovely. All cats are lovely. All breeds are lovely. First of all, if you're not getting a pet that's appropriate for your environment or your lifestyle, that you're not going to be able to succeed in being an owner for that pet. That pet is going to suffer. You're going to suffer because you're not able to. They're going to manifest, and trainers are going to talk to you a lot about this as well, but they're going to have, episodes of aggression. They're going to have episodes of tearing down your house. You need to find a pet that is suitable to your lifestyle. And it might not be a dog. Let me put it that way. It might be a different species. Some people may not like cats, but cats are better suited to their environment.
I mean, dogs are a bigger responsibility than pets.
And people might think that rabbits are cute and cuddly, but rabbits are very hard because they have a lot of husbandry needs. They have a lot of dietary needs that people don't take into account, and they have a lot of health risks associated with that, including sudden death, that if it's not followed. So, and they do cost money. Because people think hamsters have certain needs. They live 2 years, but they have needs of their own. You have to get, whatever pet, and first of all, know yourself and know what you can contribute, what your schedule is, what is your timeline, what financial contribution can you give? Because if you have spare money, you will be able to provide better care, but maybe you don't have spare money. What can you do, right? Do the best you can with the budget that you have anyway. I'm not trying to say don't get a pet. I'm just saying be realistic with what you have in your environment. But please research the breeds. And also, one of the things that is really interesting to me is I will see puppies or I will see kittens, and I will start talking to them what we call breed dispositions. People have no clue that sometimes Dachshunds have back problems. Or they might know that one thing, but they don't know all the other problems. People don't know that actually Frenchies have now surpassed Dachshunds with back problems. So French bulldogs are now statistically have worse backs and present with worse backs than Dachshunds and the long back dogs. People don't know that.
No, we didn't know that.
No, I didn't know that. We see a lot of Frenchies. Yeah.
Know your breeds, and also once you get that breed, know what's not. We talked about this before. Know what's normal, what's not normal. People get used to these brachycephalics. Listen. I love brachycephalics. As you know,
I know. I mean, you're talking. We've got cats and dogs.
Yeah, you got the brachycephalics, but know what's normal for the what's normal anyway. Full stop. Yeah. And know when your pet is not doing that thing.
Yeah.
So if your pet has brachycephalic obstructed airway syndrome, BOAS, we always call it BOAS. If they're sitting there and they're making a ton of noise, you're used to it, but actually that's not normal.
No.
So you need to take special precautions for that pet in certain times. And we talked about it during humidity. People all know about the hot and to keep them out of the heat.
Forget about the dogs, especially those, the bulldogs.
Sometimes they know about the dogs and they're like, oh, it's really hot outside. I'm not going to take them outside. But actually what we don't often pay attention to is humidity. And we talked about this when I visited you that one time, wasn't it? Is maybe it's not super hot outside, but it's super humid. And you were telling me about your hair. And it's humid.
Exactly.
And same thing with me. But that's when a lot of times we underestimate the problems that they have because we kind of get used to that sound.
People see that and they go, oh, it's only 19 degrees, 20 degrees.
But the humidity is high.
So how is that going to affect your pet? Exactly. If your vet at some point has said, oh, I hear something with the heart, and now we're having really bad problems in the heat and the humidity, that cat or dog might be going into cardiac failure. Do you know what I mean? So these are things. Know what's normal for your pet, but also what's normal in general. So if your pet is not showing those signs, you need to talk to your vet. But I would love for people to come and talk to a vet, and we wouldn't even charge you necessarily for that most of the time, and have a conversation with your vet. Like, I'm thinking about these breeds. This is my lifestyle. What should I expect? I would love for those conversations don't happen anymore.
I don't think a lot of people do. They come in. I mean, I've seen so many people come in with boxes of puppies, and they say, this is our first dog.
Yeah. And they have no clue.
Wow.
Yeah, and then the most high energy dog.
And I know they're not all like that. Well, most boxers are like that. But, you just go, gosh, they are hard work.
And then in about 3 years' time, they're asking us, when do you think he's going to slow down?
Yeah.
When do they grow up?
They're not.
Yeah.
The Peter Pan of the dog world. They never grow up.
I mean,
and it is...
I was at a dinner party with some friends, and the sister of my friend, or the brother-in-law, asked me, what do we do about dog barking all the time? I was like, what kind of dog do you have? He was like, Duxie. I was like, well, you got a Duxie. You're not going to stop, So that's why learn what is good for your environment. Are you going to be jogging every day for 5 miles and you're going to be taking that dog out with you? Get a dog that's going to run with you. Get a collie, get whatever. Yeah. But if you're going to get a dog that's going to sit in the apartment all day, please don't get a collie. They're going to tear it up, And that's where you see a lot of these behavior issues. The trainers are going to be the first ones to tell you that. But then you're going to get foreign bodies. They're going to be coming into the hospital, and we're going to have to do surgeries because they've been chewing things.
As well, isn't there? Because the mental stimulation is just not there for a lot of these dogs, is it?
Absolutely.
They need to be stimulated.
There's too many working breeds in normal households. That's the problem you got.
Yeah, you've got too many working breeds in normal households. You have too many Arctic breeds around. Listen, I love all of these animals. They are wonderful, but they suffer in certain environments. Please don't put them in those environments, And then the little dogs, sometimes they live forever. Jack Russells will, will survive anything.
Go on,
but they have special needs themselves. They're little dogs. Sometimes they get held up too much. Yeah. They need to walk as well. Yeah. They need to run around.
They're not handbag dogs, are they?
People are like, oh, they're just little, I'll pick them up. But then they have problem socialization. So learn what you need in your environment and get that pet. And sometimes it might not be the species you think it's going to be. I think that's the important question. Cats are fairly easy.
They are.
Fairly easy. But you have to clean litter. That's the only thing.
But you
don't have to walk out in the rain. Is the good thing.
I mean, because really, let's be honest, cats only really need to go out to go to the toilet, and they kill things, don't they? I mean, if you've got scratch pad, we've got 2 indoor cats. Couldn't let our cats out. They're just not. They wouldn't survive. They're just stupid.
But you have Persians, that's why.
Yeah, I mean that's why people I know some people do let them out, but we've got woods behind us. Yeah. They just get stuck in something, a bush.
And that's the other thing. I think a lot of people in the UK, especially in the countryside where we are, think that it's cruel to keep cats indoors. They'll be fine. As long as you give them enough simulation. Some cats are better indoors. Some cats
don't even try to go out.
Yeah, some cats need to be outdoors. No. It'll be fine. Yeah. They will learn from the environment as long as they're stimulated, as long as they have their stimulation, their proper housing, their scratching post, their everything. We don't have to let them outside. Some cats need to go outside. Some people want them to go outside.
And you can actually get these cat thingies now. They're big,
the cat condos, they're lovely.
Yeah, I've seen those.
Yeah, they're great. I want one of those.
His face is like...
You don't need that in your life.
No.
I don't.
I don't think ours do, because they've got the conservatory.
It's much the same, isn't it?
Yeah. They just sit looking, Oh, look.
Yeah.
What's that up
as
there?
long as they have elevation for cats. They
want their things they like to go and sit
hiding
on.
Holes.
And the windowsills and stuff. They love to watch things. But
just talking about that, the duration of a hamster.
Yeah.
I wish Google would have been around in the 70s when we had our first pet, because we had a hamster.
Still traumatised.
2 years later it died.
Bless you.
And it's like, why did the hamster die? And it's like, well, because it was the end of life at the end of the day. But I didn't know that. I thought they lived for
But at least
7
your
years
parents didn't go and get an identical one, which is what a lot of people do, because
they do.
We hear a lot that, and they go and get another one.
Yeah, and they think they lived like 15 years.
Yeah. It would have been hard to do that though, because I did see it dead.
Oh, did you?
Yeah, that's really
I found it dead. So
yeah.
No, but so I think so I mean that's quite interesting, isn't it? Google. A lot of people ask Google everything, and you go, oh, please don't.
Yeah, I know, but but in that case,
it would have been helpful for you.
Well, it'd be nice to know, wouldn't it?
Yeah.
So I'm gonna burst a myth here. Yeah. Google has its place.
Yes.
It's when people come in and say, I've Googled it, it's got this. Yeah. We've Googled as well, Yeah. We have our own Google. Yeah. But here's the difference. And just like with you guys, we know the sources. Yeah. And we know the background information.
Yeah, you got to cut through
so we can cut through. So I know if I look at a whole search, whatever, I know exactly which. Yeah. I don't necessarily Google. I'll Google certain things very specifically, so it'll come up with more scientific articles. But we know exactly what our trustworthy,
Credible.
sources
credible sources,
Yeah.
whereas the client might not know that.
No.
And yes, Google and AI especially.
Oh, we have
to Facebook
we have the
yeah,
same
as
problems.
well.
We have the same problems. People Google stuff and they come in and they say it, and you go, "Well, where did you hear that?"
Yeah.
Facebook bothers me more. I'll tell you why. Listen, I get it. I think clients, they don't want to spend the money. They don't want to get off their couch to go somewhere, which is part of why I'm doing this. I get it. It's money, it's time, and if it's something that can be easily resolved, I would do that too. Yeah. But anything medical, and I think we've seen this with human care as well, you have to be really careful with what other people are telling you. Vets have a legal responsibility. Yeah. We have a professional responsibility. We have a code of conduct that we are liable for the advice that we give. And there's legislation around that as well. We can't just willy-nilly give any medication. We have to put our hands on that pet to know that that's the appropriate medication to give. People on Facebook don't have that responsibility.
It's opinions as well. You've got to be careful.
And what works for one person
exactly
doesn't necessarily mean it's going to...
So a lot of times they'll say, oh, just give it a paracetamol. That might work for your pet. But what if this pet has liver failure or significant liver disease?
You wouldn't give it
and
paracetamol,
now you have told it to give it this medication. Or one of the things that I got is like, we were talking about the cost of medication on Facebook, and somebody's like, oh, you charge so much for ibuprofen. I was like, well, first off, ibuprofen is toxic to pets.
You wouldn't give it to a dog anyway, would you?
Please don't give your pets ibuprofen. So these are the things. People do it in a well-meaning way because of their own experiences. But and I know that it is within the context of a larger... I am not going to go to a shoemaker and ask them and tell them how to do their job on making shoes. I'm going to buy their shoes, but I have no clue.
No, absolutely.
Or go to a watchmaker or go, and that's the thing is, yes, we also use Google, but we know exactly what to look for. Yeah. And we also have our other resources. All those books that you see vets have, we haven't read them all cover to cover. No. We use them as resources. Yeah. And we use, nowadays my resource is my phone. I have a lot of books in my phone and I have a lot of apps in my phone that are specific to veterinary for me to look things up. It's not that I'm Googling it on my phone. It's that I have specific things that are resources. And
I think it is just when you're learning, because you're always learning as well, aren't you? We're all continuously
every day's a school day.
Every day's a school day.
It is, and it's the same for us when people come in and they'll go, and we say, well, perhaps maybe you want to go see the vet.
Yeah.
We're not vets. We can talk to you about nutrition, food, that kind of stuff, but we are not vets. Yeah. So that's something you really need to go and see a vet about.
Yeah. That's one of the things, even if they ask me on Facebook and I am a vet, I will tell them, go see your vet. Because I cannot tell you about your pet. I've not seen the pet. No. I'm just going off of what you're asking me on Facebook or whatever. Yeah. I'm sorry, I can't tell you. You need to go see your vet because your vet will know more, whatever, and examine it and see what's happening. So even I will say, go see your vet. And here's another thing is all of vets are obliged if we are stuck or if we all have some skill sets, right? There's specialists and, or some people do something more or less than others. We all work together and we talk to our colleagues and say, hey, I'm really stuck on this case. What have you done? But that's a colleague conversation. Yes, you can always seek a second opinion. If you don't trust it, I am not at all worried about people seeking a second opinion because it's about trust. Yeah. I once had, again, when I was in the clinic I'm at now, I diagnosed a dog that came in for lameness. Lovely staffy, really bouncy. Came in because his leg was lame, diagnosed that he had a cruciate disease. He needs to have a surgery for that. In the middle of doing the x-rays, I saw his spleen was huge and had lots of lumps. We had to take out his spleen.
Gosh.
It was good because it hadn't ruptured. It would have been life-threatening for him. Yeah. The problem is that he wanted a second opinion. Great, please go get a second opinion because if you don't trust what I'm saying and you're going to go put your pet through this major surgery and you're going to put potentially that pet's life at risk, I want you to get a second opinion. Please do. We say that for human medicine. I want you to do it for veterinary medicine as well. So if you need more information, please seek it. But again, we're doing that behind the scenes as well. We are always talking with our colleagues and our friends who are... The problem with vets is that all of our friends are vets. Yeah. So even in our social lives, we're like, hey, by the way, I have this case. What would you do? And we're always having this conversation. Yeah. So yes. So that's the kind of trick with Facebook and Google is please see your vet. And
No, well answered.
Yeah.
Well answered. So let's go back to practice then.
Yeah, sure.
So what's been your biggest challenge building an independent practice?
Many challenges. So many. I'm still working through them. So I was a clinical director for the corporates, the big bad corporates, for several of them, as a matter of fact. And I thought I was prepared.
Yeah.
I was not. Because I had big teams helping me, and I was a clinical director, so I didn't have to do the marketing side. I contributed to that. I didn't have to do, all the...
You're wearing a lot of hats now, aren't you?
Yeah, I'm wearing a lot of hats now.
Welcome to the world.
Yeah, right? So that's the challenge, is kind of figuring out, not only is there the business side, there's the legal veterinary side of things.
Yeah, I mean, you have got another few layers there.
Yeah, I have the layers of, I have to... Every clinic has to have certain, when they store medications, I have to have a legal, limit on what there's, what am I going to do with certain drugs? They have to be in certain storage, locked away. So there's lots and lots of legalities that I have to take into account. And especially being a mobile vet, that also...
Even more so, I would say.
Even more so, yeah. Because where I store it, and also how I transport it.
Well, exactly. Especially if you get stopped by the police and say, what are you doing with them drugs in your car?
Exactly.
It might be a little bit obvious, though.
Yeah, exactly. And I have to have certain... So there's a lot of... red tape that I'm learning as we go. And I thought I knew it, and... Don't we all start like that way?
Yeah.
Don't we all start like, it'll be fine, and you're kind of like,
I'm going to open tomorrow.
I have to do that piece of paper that I knew nothing about. And now with the changes and the CMA, there's even more that's coming down the pipeline, which is affecting independent clinics more, unfortunately, than it is the corporates. There's more fees that are affecting us a little bit more because we're small potatoes compared to the big boys. So there's going to be a lot of changes. I don't know. We'll see.
Isn't it a little bit unfair?
Yeah. The CMA, the Competition and Market Authority recommendations, I think are not going to have the effect that people will want them to.
It doesn't sound like it's loaded on the right side there, does it?
Yeah, I think.
Why is that, do you think, though?
Well, listen, you're dealing with Davids and Goliaths, right? And you're dealing with governments who are dealing with Davids and Goliaths. I think a lot of people just want the relief of the costs.
Yeah.
Just like anything else.
Yeah.
And I understand. It's a business, and they just don't see the backside of it, and they don't understand. What they don't see is how many years things have been increasing, and why prices have been increasing. And we will have those conversations of, the vets are charging me so much. What they don't see is that the vets are paying so much. So the cost of me running a small micro business that's bespoke is very nearly the cost, not exactly, because I don't have to pay right now bricks and mortars fees, but because I don't have the volume, I still have to have the same medication. I still have to have the same legislation. I still have to have the same paperwork and red tape.
And the insurances and everything else.
So that's all the same. Yeah. So I'm paying very nearly what a bricks and mortar would pay, but I don't have the volume. Yeah. Right? Now you're adding in that. Now, if you see a big corporation, yes, they have their own clinics, and each clinic is responsible for their fees. But overall, because of the amount of clinics they have a lot of heft behind them. So one of the things with the writing the prescriptions, I don't mind writing. Actually, from a mobile point of view, I would rather write a written prescription, because that means I don't have to stock it in my shelves. There are a certain amount of medications I have to have for urgency and for, like, antibiotics. I can't write you a written prescription and wait 5 days for you to wait for an antibiotic to come in stock. No. Because you need, Sprout needed it right then and there, didn't he? Yeah. So that's one of the things I have to have. And, and there's cost with that, and there's also costs of those going out of date. There's costs of some medications that I have to have as emergency drugs that, in case I see a patient, I need to have those medications. They're going to go out of date. So there's lots of costs involved with that. And the CMA is not taking into account that I'm going to pay the same for these prescription registration thingies as a big hospital that has 10 vets and is making multi-millions. I'd pay the same exact amount. Yeah. I am fuming about that.
Yeah, no, I think you should be.
So, and the other thing is, people want the respite from the cost. Yeah. But they're not going to see it. The cost is going to spread around somewhere else, because the costs to us are not being relieved at all. That has not been addressed by the CMA, unfortunately. And that I was saddened to see that, to be honest. The supplier costs, the medications costs, all those things, what clients don't see is because our costs in the back end have gone up exponentially in the last 10 years, and especially through COVID. And that has not been addressed. And the conglomeratization, I guess is the word, the monopolization, that really hasn't been addressed effectively. No. So what a lot of people don't realize is that some of these online pharmacies are actually owned by the same company.
And I think this is the issue, isn't it? A lot of people don't realise, and this is where...
But it's out there.
It's out there,
but
and they're allowed, they can charge whatever because effectively they own... I know there are guidelines and everything, but effectively, that's their company. So of course they're going to have access.
They're going to make the
drugs.
profit anyway.
Of course they're going to make it either way, aren't they?
It's coming either way.
So what can we do as clients to support independent vets, do you think?
Oh gosh, I mean, one of the things. Listen, I don't want to take away from vets that work in a corporate.
I don't think you're going to have to because people are making their own choices.
People are making their own choices. I think the main thing is whether it's an independent or a corporate. Find a vet you like and you trust, and you have a communication with it. I think that is the heart of veterinary practice and medical practice, really, is have that relationship with the vet that you like and likes your pet, and that might not be me. Every person is different. Again, you said about somebody needing sort of more direct responses. Maybe somebody needs a more direct vet than I might be. I can be sometimes direct. But maybe somebody needs a little bit more of a soft touch, for instance. Maybe somebody needs in and out, done, bish, bash, bash. You have to find what's right for you, right? I think that's more important than anything else, whether it's independent or corporate.
No. But a lot of those vets are now in independent vets. You're finding more and more people saying, they've had a trusted vet, and a lot of these vets are now coming out of the majors into the corporates and setting up their own practices.
Yeah, like myself,
and this, I think... vets are walking themselves, aren't they? Which
you're seeing more of a movement to independent for a lot of reasons, and a lot of it is that we sort of did the corporate thing, and I am putting myself in this boat. I definitely did the corporate thing because that's what was happening. The corporates were buying a lot. Now, we aren't meant to say corporates. We were meant to say large veterinary groups, LVGs, whatever. But they were buying up a lot, especially around here, London and the home counties.
There are so many of them here now that. You say, because, we look at them going, but that's not an independent vet anymore. But they haven't changed the signage, which they should do.
So now they have to.
Yeah.
That is the one good thing is now they do have to. I know that it's a corporate because I know where to look on their website to see that it's a corporate. But, so there are a couple companies that do brand themselves as that company. There's a couple, you're right, that wanted to keep that trust going. And they never rebranded and then just changed the website and the... Basically, you can tell by the bottom of the address on the websites, right? So now they are required to. The CMA has said that, and you are now seeing changes in some signages on some of the larger groups.
Transparency.
Yeah, transparency. Exactly. And I totally agree with that. It still doesn't affect the vet in the room.
No.
The vet in the room is going to do what they're going to do, and they are professionally obliged to do so. The vet is going to be affected by the back of what's happening and what they're being told. And that's where the stress comes in. How many consults do they have to see in a day? How long do they have to see the consults? How many opportunities do they have in a day to contact clients? Because right now, some places are not giving opportunities to vets to contact their clients. So clients are frustrated. So it might not be the vet. It might be the pressures that vet is under. And yes, the vet theoretically in the room can do and treat your pet the way they see fit. But there are other factors that the vet is aware of. That's the benefit of being... a mobile is I don't have those factors, but I might have the factors of, can I transport that medication to you? I need to forward plan bringing vaccines to you. Yes, I have a refrigerator, but I have to transport everything. And do I want to bring in a whole big, I'm going to bring that vaccine for that pet. So the more knowledge I have beforehand to say, listen, my pet has an ear issue, has been scratching, has been this, then I will bring what's appropriate for that pet right now, especially in the heat because of the storage issues. Whereas, that all might be available in the consultation room. I have to think about that a little bit more, which is a challenge. But the more information I have from clients, the better. But I can give them the time. That's the benefit of me doing this, and that's exactly why I did it. Is I can give that pet the time, I can give that owner the time where we don't have that luxury, and it is a luxury service. Because of that, it is a luxury service.
Yeah. So, what skills do you think you need or needed to do this now that you weren't taught at veterinary school? Because I suppose when you're going through school and training and everything, and they teach you about, I mean, I don't know how much running your own business that you get taught in.
Nothing.
You're just like, here, just
now,
go be a vet.
So now they're starting to get some training. Not to run your own business.
No.
Not to run your own business. So I got zero training. I'm fortunate that I have family that's business, but in a different country.
Yeah.
Right? So I had to relearn things as I came up in leadership and veterinary. First of all, there's two things you have to learn. Coming out of university, coming out of veterinary school, you're not a fully fledged vet. You are a fully fledged vet. You can treat things. You just don't have the experience. So you need the experience and the team of more senior people around you to help you kind of, because you've never seen that thing before. You've seen it on the books, right? Whereas I've seen a lot of cases before. So from a clinical standpoint, I have been clinically, I can stand on my own. I can do a sole charge, which is not something that you can do straight out of veterinary school. So that's the clinical side of it. That's the easier side for me is, it's a lifetime learning. It's the easier side of things. So now adding in the business side is the financial side. It's the legislation side. It's the marketing. It's all the soft things that you would learn in business school. It's a whole other postdoctoral education that I'm doing right now. It's interesting though. It's really interesting. But there's definitely things to learn, and there's definitely mistakes and tripping on myself. Things kind of get shut down. You're kind of like, what's going on? So I'm trying to be more consistent, but it's still the beginning, and I'm trying to work.
It is difficult when you're thrown in and you're in that environment, but that side of it is completely alien to a certain degree, isn't it? So how do you balance the clinical with the business side of it then?
I do like the business side of it. I don't like it enough to like send you a bill, for instance. I think the balance is we all love what we do clinically. No vet wants to actually charge for their time and money, so you have to kind of say, I am worth that amount of money, and I need to send that bill. And I have paid all these medications that need to get paid off now. So even though this is the business that we're in, you're always kind of like, it was a little thing, but actually that little thing takes a lot of skill, and knowledge that other people don't have.
No, of course.
We're all in that boat in some extent. So that's always interesting.
I can imagine. So what advice would you give to anyone else that's sitting out there that's maybe, at that point in their career going, do you know, I'm just going to set up on my own. What would you say to them?
Yeah, I mean, I think doing this predominantly on my own, I do have some support in the background, but predominantly on my own, I think it's hard. I think if they have a support structure that they can have with their partner or a friend, I think would make it a little bit easier, because then you can kind of split that. Like I said, I have the benefit of having a background in veterinary leadership, but even that's hard. I think first of all, make sure you have the clinical skills to be able to do charge in a house environment or in a not comfortable environment. That's the benefit of having mobile clinic, is at least I have that with me. When I can bring that out, I can't always. So I can fall back on that to know where things are, to know, but beyond that, clinical side, and that's always learning. That's always learning. So you're never going to get confident enough. You're never going to get good enough that you're going to be like super vet, not the super vet that is marketed a super, But the business thing is just do it. I think that's the thing is we as a profession are very perfectionistic, and that we suffer from that because we've had to be in order to become vets. And I think once you get to the point where you're comfortable enough and you're starting to think about it, just do it. Because it'll benefit the business, it'll benefit the profession, it'll bring more independent vets forward, it'll bring more competition for people to have options. Just do it. I think it's a really good thing that more independents are opening, and I really hope to see, not more independents, but I hope to see less corporates and those getting bought up by independent vets.
It is such a shame, and we've always been fortunate to always have an independent vet, haven't we?
Yeah.
We've always, and the only time we've been to a corporate, it's been out of our care. And
unfortunately, that's full stop as well.
I'm not going to name anyone because I don't think that's fair, but to be fair, that was never a good experience. Was it? The one every time we've had to use them, whether it be for fosters, it's like, God, this is awful.
Like I said,
and I know you have to.
Yeah, no, like I said, I've worked in corporate for a long time, and the vets and the teams themselves are doing the best they can with what they have. And right now, people were used to sending their pets to their vet, and they would stay overnight. Yeah, we can't do that anymore. It's too expensive. Yeah. There's not enough pets. I'll be honest with you. I've been in clinics where we've had to let go of our out of hours purely because you have one pet a week, but that's not enough to cover the team that's covering them. Yeah. Or you have the other worst option, which is you leave the pet there without any oversight, and we don't do that anymore. No. We are beyond that point in veterinary medicine now. Hopefully, there are some places that do it with consent from the owner, but we don't do that really anymore like they used to. And the vet goes to bed, and then somebody will check on them at 3:00 in the morning, and then because too many things have changed.
Yeah. There's too many variables.
There's too many variables. There's too many risks.
Yeah, absolutely.
So that's why we send them to an out of hours, because they have that oversight. But that's expensive.
So, do you think mobile veterinary medicine will become more common in the UK?
It already is.
Yeah, well,
it already is. So, I think a lot of people are coming to the same conclusions I am. It's a better work-life balance for vets once you kind of get to that point, because again, we want to spend more time. Yeah. I would like to breathe fresh air in between consultations and drive in the lovely, as long as it's not snowing, in the lovely countryside.
It's nice in summer.
Yeah,
but
it's nice in summer.
You don't get much snow though, really, anymore. Not
I'm from Chicago,
here.
so I'm okay in this part of the.
I mean, they don't get much here, but we just don't deal with it as a country very well, unfortunately.
Yeah, that's sort of the problem. Is the
it's the road.
Anyway, but it's also, again, I have my own theory. I don't know if this is true, but from observation, because the cost of getting into veterinary and opening businesses is higher because the large groups bought up so many. There's not the partnership path that there used to be in the old days. There used to be, you be a vet, the older vet had it, and you kind of buy into it slowly over time. That doesn't exist really anymore.
No, we've seen a few of those go the opposite way, where they obviously offered the pathway, and then it's been taken out from underneath them, really, by selling out to the corporates.
Yes, I have seen that as well many times. So the pathways, people used to say vets didn't want to be owners anymore. That's not true. Vets have always wanted to be owners. It became too difficult. Yeah. And I think now the balance is it's becoming difficult to stay in some environments. Some people are enjoying those environments and they're thriving in those environments, and I cannot take that away from them. Some places are still able within that corporate environment to still practice good medicine. I can't take that away from them, but some people no longer want that for themselves. I didn't, and so opening an independent is better for them, and for some people like myself, we're looking at mobile.
Sources for courses.
Yeah, exactly. And again, I came to it. When I first came to this country, I was like, you're expecting me to go to whose house now? And I've come all the way full circle to say, I'm going to go to their houses and take care of their pets, because that's the best thing for them, So I think you're going to see more. Interestingly, you see more in the north, and starting to come down here.
Oh, okay.
Yeah.
We've got a few popping up around here. I noticed that. Okay. How do you see technology changing the way veterinary care is delivered?
That is the main reason why a lot more mobiles are going to come out, because it's more now. People expect more, but B, the technology is becoming small enough that I can carry it
mobile
in my van. Yeah. I can, the goal is to have it as a fully functional mobile clinic, right, including anesthesia. So those are things that I can do out of a van, out of an ambulance, that previously was not able to be done, right? There are ultrasound machines now that are small enough that I can carry. There are there is equipment now. X-rays, unfortunately, has not gotten small enough for me to carry yet, but there are some machinery that is mobile now. Yeah. And interestingly, the horse side kind of brought that to us, and we're kind of learning more from the equine side. And then on the other side of it, AI is now here. Now, I said before, AI is not going to take my job because they're not going to be able to do the physical examination. But now I can take notes and talk to a client, and it'll transcribe it for me. And like I said, it can send out the I check it and make sure that everything's complete, and then I'll send that email out rather than me sitting there and writing notes for an hour. Because what people don't understand is clinical notes should be as complete as possible, and if that AI can do that for me, all the better, right? There are costs associated with it, of course, but you know. And the benefit of having resources computerized and at the tip of my fingers rather than having libraries worth of books that I can't access when I'm on the road. All of those things that we don't think about, those cost money, but they are beneficial. You know? So those are all technology things that I think are going to make and are making being a mobile much closer to the experience of an in-clinic vet. You know, I can take some, not all, but I can take some bloods in my mobile van. You know, but there are some bloods that I can't do because it can't tolerate the jostling of the van.
The vibration.
Yeah.
Right, okay.
So but then I can do it and I can send it out to an external lab.
Yeah.
Whereas the old guys, the Jane Harriets, had to do that all in house. You know, we have other resources to us. You know. So
So what aspects of veterinary medicine should never change?
That
regardless of the technology.
Absolutely, that hands-on approach. That person-to-person relationship.
It's still got to be there, isn't it?
It's still got to be there. Like I said,
AI is not going to replace you.
AI is not going to stick their finger up a dog's bum. Trust me. Do you know what I mean? Like,
it can't replace it. Can it?
No, it can't replace it, and you need that human touch. You know, as you know from your previous employment, you know, in profession, there are things that humans can see and can feel and can get from an emotional, but also an exam. There's touch. When I'm touching an animal, you know, there's different things that an animal can do. Every pet is completely different.
And it's what senses can't pick up.
It's what senses can't pick up. And you know, and then on top of it, it's that relationship. It's that relationship. It's that trust. It's that communication. It's that human understanding. So, you know, telemedicine is interesting because there is that conversation happening in veterinary medicine now. Telemedicine is something that currently, under the guidance, can only be done from a colleague to a colleague, right? So if you bring your pet to me, then I can examine it, and then I speak to a specialist over the phone or over a video, and that's something currently that's being... But I think that's correct. But there's a lot of debate going on about that because I have examined that pet, and I can relay the information from a clinical standpoint to that specialist to get that information, right? That becomes hard when it's a client to a owner, to a client to a vet, because there are things that client will miss. They are not professionally trained. No. They know their pet for sure. I'm not trying to dismiss them and their background, and that their experience is very valuable. Without them telling us what's wrong, we have nothing. But that relationship and that touch and that exam, without that, we don't have veterinary medicine. We just have dispensing of drugs, and you're going to miss the mark more times than not if you're just sitting there doling out drugs. And that's not what we do. We try to... That's what people sometimes think we do, but we're trying to come to a conclusion, and sometimes you have to kind of figure that out through the exam and the conversation.
Well, it is. It's gathering that information. That hands-on approach is so important without it, because you know, if you touch a dog and then a dog reacts in a certain way, and you go, "Oh, hang on a minute, a dog's tender there." Well, how can AI do that without actually physically?
Absolutely.
You know, and like you say, probes, unless they're in the right place. Well, who knows what the right place is at the time?
And I'll give you a really good example of that dog that I found that we had masses in its spleen. If I didn't examine it, and if I didn't x-ray it for the leg, and I didn't examine it while I was under sedation, we would never have found that, because we were super hyper-focused on the leg.
Perfect example of it, isn't it?
We would never have found the thing that would have actually killed it within a very short period of time.
Absolutely.
You know what I mean? And that was a very good example of how important an exam is. And that should never go away.
Right, personal questions. What's the most memorable case you've encountered during a home visit?
During a home visit.
And this is not our home.
There's been so many. Marnie is one of them.
Yeah.
The big cane corso. She just trying to give her one injection when after she ate the sock was, an hour of just sitting there and just trying to try to tempt her with treats. Yeah. And in the end, all you had to do was give her a bum scratch.
And that's it. You could have saved yourself some time.
Yeah. The other one was Archie. Archie is the little dog who I said had the ear infection, but the owner has some mobility issues. He was hilarious because he would just come running into the ambulance like it was an ice cream truck, and he'd be like, "Thank you." But then if you went into his house, he's like, "No." He was very they're all very memorable, mainly because we're still new, and so I can remember all the cases. There was one, bless him, big Mastiff. Very sad case, ended up having to be euthanized, but just really struggling with him and his owner being so devoted, and Dante was his name, and just not being able to get it, but also trying to balance, are we going to go see a specialist? Are we going to have a CT scan? Is this appropriate for you? It ended up not being appropriate for the owners, and we ended up having to let him go. And it's just so sad. So there's so many cases that kind of stick in your mind. And there's many cases in my career that just stick out in my mind. It's mainly the ones that you've kind of been invested in and you struggle with, and you've seen them time and time again, and you kind of said, okay, that didn't work, we have to do this now.
And I'm sure you'll continue to make lots more and have lots more cases that you remember.
Thank you.
So what's something about veterinary medicine that still surprises you?
Oh gosh, everything. I am surprised daily by veterinary medicine. I think that's why I love it so much. There is interesting things, techniques that will pop up now in colleagues will say, I've done this one time and it worked really well. Now we see colleagues putting examples on TikTok, and you'll say I saw a case as a trauma. It was a little kitten. It was a trauma, and I had and the jaw was all out of whack, and it was out of its position. And I remember seeing a video of a vet in the US doing a technique with a pencil to get the jaw back into place.
Wow.
Nobody in that clinic had done it. I randomly remembered it from watching. Please don't go on Facebook and see these things. These are done under very special circumstances and completely anesthetized.
Did you actually say TikTok a minute ago?
It was. I saw it on TikTok. It was a vet doing on TikTok, teaching other vets. Thank you very much. And it was a very controlled environment because it was under anesthesia, and we'd done X-rays, and we knew exactly that this was the reason. And I was like, and we were running around trying to find the exact kind of pencil because it needed to be one that was hexagonal. Yeah. But it had to be the pencil so it can grip down on it. So nobody uses pencils anymore. No. So we're all running around trying to find an actual pencil. And we ended up, so.
Did you get it?
Yeah, got it.
Pencil. Oh wow.
Got it. We found a pencil somewhere, and we because it couldn't be a pen because it was slipping. It had to be a pencil, and we ended up doing it, and the kitten was fine.
Wow.
Yeah, the kitten was fine, and he was under therapy for 6 weeks because it had a broken jaw, but it went into place, and it was able to eat. And it was howling in pain, that poor kitten, and we ended up saving
a dislocated jaw. Then I take it.
It was a dislocated jaw due to an RT. It had other problems as well. Yeah, that's why I'm saying please don't just do that.
No, you don't stab pencils.
So I'm constantly learning in this gig, and it's really cool, and that feeds my constant kind of need to learn, and that's why I say every pet is different, every situation is different, because even if you've seen it 10 times before, like I have seen infected ears, I see them 10 times a day.
I was going to say, they do say
I see diarrhea cases 20 times a day. So I see vaccines all the time, but every pet is different. So the fact that I can approach every pet a little bit differently, yes, sometimes maybe the conversation is similar, but I always have to change it around for that particular pet.
And I suppose there's always going to be that one that may surprise you out
There's
of all
always
of those.
that one that surprises me. There, you always have to keep an eye out for that one.
Yeah,
because you cannot be complacent in this job. Yeah.
So what keeps you passionate about the profession then after all this time? Apart from...
That's exactly it.
Yeah, that's exactly it. Yeah.
Hunger.
And the fact that I still love the pets. I still love the fact that they come running up to me, or even the scared ones, if I can get them to, I've had clients that bring in some cats that have said, "Oh, you can't get near them; they won't." And then you kind of just give them a little cuddle and a little stroke, and you give them the time, and they start purring, and they've never done that. That kind of gives me a little vibe, because you're able to make that owner and that pet feel a little bit better.
Yeah, it's that connection, isn't it? Once you've made that connection with the pet, then it's there, isn't it?
So that gives me, that really makes my day. And I see it all the time. It happens more often than not. Yeah. The bad times stick in your mind, but the good times happen more often than not every day. Yeah.
Yeah, it's true, that is. Yeah. So when you're not working, why do you relax?
So we said this off camera. I sleep. Because I'm usually working so much that I'm exhausted. I go home and I kind of crash on the couch. I'm trying to do the business side of things. But when I relax, I try to get away, to travel a little bit. Obviously, I can't travel too much now, too far, because I don't want to leave the business too much. But I'll be in Greece not too long from now, just relaxing on a beach somewhere and just not thinking of anything. Because otherwise, if I'm here, I'm always...
Is that with family, is it?
This one is just going to see friends. Yeah, this one's just going to see friends. My family will be later on in the year. Yeah.
It is important that you do need to switch off as well, isn't it? Because I think when you're running your own business, regardless of whatever it is,
absolutely.
I mean, we can vouch that. We don't have a computer
hard,
at home
it?
for that. Yeah, we don't have
hard.
computers at home for that reason anymore.
We took it away, didn't we? Took it away.
So, and that's one of the other reasons I have the business phone and I have my personal phone. My personal phone never rings, because but when I'm away, I turn off the business phone so that I can at least just talk to my friends, and it's not ringing, it's not bothering me. But I do find, kind of like you, I do have to get away, because if I'm at home, I'm doing constant work.
It's very easy to slip into bad habits like that.
And I think it's very easy for people to forget that people do have personal lives, and unless it's an absolute dire emergency, for you.
And I do. I think this is the other benefit of me not being straight out of veterinary school, is that I have learned over time that you have to have boundaries, and I've made the decision sort of early on that I can't do this 24 hours a day, because I do need to sleep at some point, because otherwise I'm not going to be a good vet if I'm going out. And I was an emergency vet, but that's not what this is. This is a general practice, with some minor injuries, just like you would do in a general practice, principally because I need to be able to have sleep in order to function better the next day as a vet.
Passing over to you then, Andrew, for
a
quick fire round.
A quick fire round. There we go then. Right. Cats or dogs?
Oh, both. But I lean toward cats. Don't get mad at me.
Most underrated pet species?
Underrated. Do you know what? They all have their own thing. I can't really commit to that question.
Okay.
Sorry, they all have their own thing.
One veterinary myth you would love to eliminate?
Oh, we hear it all the time. Usually when people are mad that we're all in it for the money. Trust me, we are not.
Right.
We are not.
Okay. Most rewarding part of being a mobile vet?
Most rewarding part of being a mobile vet? Giving the time and building that trust and tailoring everything to that.
And getting out in the countryside evidently as well.
But not the snow.
Breathing fresh air, yes.
Coffee, tea or neither?
Tea, 100%. Always have been.
Always tea, yeah?
Always have been a tea drinker, even though my family's Greek.
I was going to say.
Coffee culture. I grew up in the US, coffee culture. Yeah. Always been a tea drinker.
Why?
With milk, by the way. Very weird. Everyone looked at me like I was crazy when I was in Greece when I did that.
But you're in the right country.
I am in the right country. Maybe that's why I stayed.
Yeah. It was the tea, nothing else.
One book every pet owner should read.
So there is a guy named Nick Trout. He is a specialist out in the U.S. I read this book before, or right around the time I was going to vet school. I think it was right when I was in vet school. Tell Me Where It Hurts. Now, it's a little bit older. It's not a new book. But it is a really good book about the day-in-day life of a specialty hospital in Boston, a very famous one called Angel. And I ended up doing an internship not far from there at Tufts University, Massachusetts. And that book was very eye-opening. And I think that is a much more realistic portrayal of the veterinary world and what pets see in a veterinary hospital and what vets go through in a veterinary hospital. I think the obvious choice is everyone has read James Herriot. That no longer applies.
No,
that no longer applies.
It's a bit old school.
It was of its era.
Yeah,
it was of its era. It is no longer that era. No. So yeah, I think that is a good one. Is Tell Me Where It Hurts by Nick Trout. Again, it's more than 10 years old now, so even that will have evolved. But that's a really good book.
One piece of advice for new pet owners.
Oh, I think we talked about this before. Please research the breed you're getting.
Research the breed or whatever it may be.
And the breeder especially. If you really want one breed and that you found that is the breed for you and that fits in your lifestyle, please also research the breeders.
Health checks. Make sure that they've done everything. There's a lot of people doing some pretty not great things with breeds right now, and it's causing a lot of health issues, which will end up being a problem for you down the road. Yeah.
Okay. And one word that describes the future of veterinary medicine.
Transition. We're in a huge transition right now. Like I said, everything is in flux.
Yeah.
The prices are in flux. The ownership is in flux. Everything is in flux right now. And, I don't know how it's going to turn out. Is it going to be a good thing? Is it going to be bad? I mean, overall, it's going to be a good thing. At what point, though, is it going to be a good thing? I don't know. But I think that's true of the world right now, isn't it?
Well, yeah, I think it's not just isolated with
it's not
vets.
isolated, no.
There's so much uncertainty, I think, with everything, isn't there? That
everything is sort of coming forward. And, so it is a symptom of the environment we're in, is that everything is in flux right now. Everything's in transition. So, it will stabilize eventually, but when that will be, I don't know.
Okay. That's it. That's a quick fire round over.
Yeah, so from one final question.
Sure.
Put my teeth back in. Question for me. If all the pet owners listening today could remember just one thing about caring for an animal, what would it be? What would you encourage them to do? Or what would you want that message to be?
Send me a WhatsApp.
WhatsApp, yeah.
Send me a WhatsApp if you have any questions, and I'll come out and take care of your pets. No, I think just have, like I said, just know what's normal for your pet. Know what's normal in general. If there's any changes to that, you can keep an eye on them for, depending on how severe it is, a day or week or, an hour. But get in touch with your vet. You can have a conversation with your family, but if you're really worried and it's something's off about your pet, talk to your vet. Like I said, if needs be, the best way to communicate with me is through WhatsApp, honestly, because, if I'm with a client, I can always answer a WhatsApp and schedule an appointment. If you don't want to see me and you want to see your regular vet, please see your regular vet. But know what's normal, know what's off about your pet, and talk to your vet. Better to see it early and get a jump on it than wait too late and it's, it's beyond the point of, help. Or it needs a lot of help.
So is there anything else you want to say before we go? And we're going to let you plug your socials, so how people can contact you and everything else. But is there anything else you want to add?
No, I mean, I think what you guys are doing is fantastic. And I think the community that you're building is a wonderful thing. And, I think that's, again, part of it is we need to come back to community.
It is,
with all these things.
And I think quite a few people were quite surprised when I said, "Oh, guess what? We're gonna have a vet in here," and they're like, "A vet?
Yeah.
Really?
Yeah.
Really? Yeah." Because it's they're humans.
Yeah.
Most of these people. They are human outside of their consulting rooms. And I think a lot of people forget that, don't they?
Yeah.
I think that's been quite nice. A lot of our customers have like, gosh, really nice, isn't it? Because it's not something they're used to.
Yeah, 100%.
And I think that's nice.
Yeah, I completely agree. I think the community, we've lost it in the pet health world, and I think too many people are against each other, and we just need to have those conversations, and owners need to have those conversations. We need to do a better job about having conversations, but I would love for owners to ask me questions. This is why I come to visit you as well, and we're going to be coming to this clinic here at Edenbridge as well. But people will send me a text and say, "Hey, my pet is unwell," and I'm not going to come out to your house if I don't think it needs to be seen, and if it just needs because there's no point in you paying me all the money for the consultations if it's something that you can just watch. But if it's something serious, we should see it. Yeah. So let's build that community. Let's have those conversations. Yeah. We're all human beings. Nobody's in it for the money. We're all in it to help the pets at the end of the day.
Because we'd all be on the beach somewhere if
Trust
we
me.
were, wouldn't we?
Yeah.
Trust me. I'll be honest with you. But I think that's the thing is we, we all as a society have kind of lost the community. We're coming back to it.
No, it's right. I mean, you are right, because there are so many, it doesn't matter what industry in the pet world you are, there are just so many big boys, or whatever you want to call them, companies out there, whether it be pet stores, vets, all sorts, that it's no longer about, no longer seems to be about the pet, the animal there. It's all about the money and everything else that goes with it. But hang on a minute, what about the pet? What about the owner as well? Because they matter in this, don't they? Yeah.
And I think that's the thing. I think the convenience, listen, Amazon. I have Amazon. I hear this all the time. I got something on Amazon. Amazon is convenient, right? Yeah. So I want to bring that convenience back, but convenient doesn't always mean good.
No.
But so
unless you're Jeff, what's his name, who bought himself a spaceship.
Yeah, there you go.
Then that's good for him, but not good for us, though.
But I want to bring that convenience. But then again, let's do it properly. Yeah. Let's do it properly so that you're not buying rubbish. Because there was a friend of mine. Many years ago, I was in school back then, and her family said, I'm not so rich to buy cheap things. If you keep buying the same stuff on Amazon without kind of getting any input, and it's not working, that poor pet is going down the line. It's getting worse and worse and worse. Why don't we give them the right stuff first? Why don't we see why don't we get the right opinion first and foremost? It ends up being less expensive for you. Some of those things. We talk about prevention a lot in veterinary medicine, and sometimes people don't listen to us, and then it's like 10 years down the line, and they're like, "Oh, you never told me." I was like, "Actually, I have notes right here. We know what we told you. You can't hide." But I think that's just keeping open communication.
Yeah, and I think the mobile side of this is great for actually bringing that community together again, and especially for
in a way, it makes you a little bit more accessible, doesn't it?
Absolutely.
I hope so. I hope so. And I think that's the main reason I did it for the weekends as well, is because there's that gap where people are busy during the week and they're free in the weekend, but they're doing what they're doing, or they walk their dog in the park and it's come up a bit lame. That's why I'm here, and that's why I'm doing it over the weekends, because that's the gap right now, in my opinion. And we'll see.
It is, because not always, that dog can't always wait. So, and the peace of mind is there, isn't it? That you will give that advice. And then that person's got that peace of mind that their dog needs to see a vet, or hey, it can wait till one day.
But the other thing I kind of want to say is that you can, unlike the NHS, you can be registered with multiple vets. So if you want to come see me as a one-off, for instance, and I do sometimes see a one-offs on a Sunday, you can go back to your original vet. You can request the history to be sent to your original vet, and that's okay too. I'd rather your pet be taken care of and then see the pet. But if you do want to see me on a regular basis, that's always available.
I think that's quite a lot of people don't know that, because quite a few people have said recently, my vet have said it can only be registered with one vet, and I'm saying, well,
no, they can.
It's not strictly true.
There's no legislation. There is, unfortunately, some large groups that are not keen on them being registered with other pets. So if you ask them to send a history,
obviously the history is the issue, isn't it?
But unlike the US, the pet owner technically owns the clinical history for their pet. So at any point, you can request the history for your pet. What you do with that is your own business. We cannot, as vets, send it to another practice without your permission. No. So you have to ask us, which is annoying sometimes for some clients, but you have to be part of that conversation. But you are always entitled.
So you're entitled to request the history yourself.
But again, you are not limited by any legislation or any regulation, unlike the NHS. To be, my pets have been registered, everywhere, because of convenience. I have my pet registered with an out-of-hours provider where I live. When I was employed in London, I still had a registration here because I needed to make sure that if something happened. So you can be registered with multiple vets. It's not an issue. That's more of an internal issue, and if that's a conversation you have to have with that vet. But I am very happy. And any vet should be very happy to collaborate with other vets. The problem comes when you kind of hopscotch vets. And, you sometimes see this with certain people that they want a discount here, or and this is older.
It
And
shouldn't be about. It shouldn't be about that. Though,
and then you
should
don't
it?
have a complete picture.
Yeah.
Is the problem? I have one client that sees a particular vet that they've seen for ages. They're very loyal to them, and that's fine. But their pet is having some mobility issues themselves, so she struggles to get that particular pet to the vet. So I go to their house for that pet for their mobility issues. But she's still loyal to that clinic that she's going to, and that's perfectly fine. And there's no problem with me having that. But we all collaborate as well, because we should collaborate with physios. We're collaborating with other specialties. So that's where community comes in as well. Is we as vets should be collaborating with the owners and with other vets. That's okay.
Yeah.
There's no competition between me and the other vets. They're doing a different job. If I need them to go back to their vet because the hospitalization, by all means, I'd rather them go to their original vet than to go to an out of hours, right? So there's no competition from my point of view. There's only collaboration. Don't be shy to tell me that I'm just seeing you for today. That's perfectly fine. Tell me what it's in the history to, and that just tells them that I'm trustworthy, and that if they need me again, I'm not going to try and do something strange.
Yeah, absolutely.
Yeah.
Right. So finally, give yourself a plug. Tell everyone how they can contact you, where they can find you. There you go.
Great. My name is Dr. Laila of Edgewater Mobile Vets. This is our flyer. You might see it somewhere around in the neighborhoods and in the shops. Definitely with you guys in the paw store at BB. So best way to contact me is WhatsApp. To be honest, we have a phone number. Our phone number is 07498 070335. You can call me. However, if I'm with a client, I might not see the call. Voicemail is okay, because then I might see it at the end of the day. But if you WhatsApp me, I'll get back to you as soon as I can, because if I'm with a client or if I'm in surgery, then I'll see it immediately. The other way you can contact me is through socials. We are Edgewater Vets _UK, both on Facebook and on Instagram. There is also a registration on the website, so you can register directly with the clinic. Like I said, you don't have to. You can go ahead and register. You don't have to pay for registration. But if you do want an appointment, if it's a home visit, there is an £80 deposit for the house call, and that's for me to go to your house, regardless of how many pets you have. So if you have 1 pet or 10 pets, 10 pets will take all day, but still, it's one house call fee for the home, and then each pet for the first consultation or for the examination, that's what a consultation is £70, and that is typically for about half an hour, although that's not really. We're not putting a stopwatch on it. And then rechecks are probably about 35, and that's about 15 minutes, which is very competitive with other clinics. Nowadays, it's about 60 to 70 for 15 minutes. So I try to stay pretty competitive, Vaccines are 85 for the course if they need the whole course, and I think 45 for the boosters.
Oh, wow.
Yeah.
Great,
But the house call fee is the house call fee. If on a Sunday you want to do the stationary clinic, that is for the minor injuries, or if you need a vaccine but you just can't get to your vet, you can still come and see me on the stationary clinic. Right now, you still have to call and make an appointment ahead of time, so it is by arrangement, but that's £80 for about 20 minutes. Yeah.
Excellent. Well, thank you so much.
Thank you very much.
It's been absolutely enjoyable, my lovely.
Thank
you very much for the brownies.
Yes, you're
as
very
well.
welcome.
I'd like to say she bought us brownies.
It's lovely. It's been lovely to be here, and I've been at the shop a couple times now. I haven't been to the Edgewater, to the Edenbridge one.
No, first time.
No, because the sign out there tells me I'm going to get shot. That's why.
I know, it keeps telling me it's not going to get shot.
It reminds me of being in the US, I try to get away from all that.
I did warn her. I was sending her a message saying, don't worry, I was going to shoot you.
I was like, I left the States to get away from all that.
Now I'm in Edenbridge and they're going to shoot me. Who knew? It's nice. And I think we'd be nice to get you back as well again, and get you talking, maybe talking to some other guests that we've had in, which would be quite nice.
But I would love it. It's a great community you're building.
Like I said, talking to Louise about the consensual care.
Absolutely.
Dogs,
And talking with physios, because like I said, this has to be a community. This has to be. Vets are not anti-holistic. No. We're pro-holistic. We want it. We just need to work with people who are doing it, correctly. And the thing with vets is that we're very evidence-based. And if there's evidence of it, and if it's working, and there's we know that
Yeah.
based on evidence that this is going to benefit the pet, then we're all for it.
Absolutely.
And this is why we like the acupuncture. This is why we like the physio. But if it's something that doesn't have the evidence, we're a bit wary because we want to know, is this going to be the best advice I'm going to give to the pet?
You do see, I think, things that go wrong quite a lot.
Yeah,
So,
yeah.
you know, and
That's the unfortunate thing.
That
Is
is
that
the
quite often
unfortunate,
vets see the
Downsides.
downsides rather than the good sides,
Exactly,
don't they?
exactly. And I think the main thing though is that because we have that legal professional liability, we have to make sure that it's something that is going to be appropriate advice to give. But we are very open if we have those discussions, most of us anyway. You know, I can't speak to everybody because like with every profession, you know, there's going to be people on each end. But yeah, we are part of the community. We're people and we want to help that pet. You know, honestly, we invest a lot of time and energy in those pets more than people know, and a lot of emotion in some of those pets. And we, you know, we want them to be well as well.
Yeah,
so,
of course you do.
Yeah, so we are more than happy to be, and I'm very open to having these conversations because absolutely, how can we make all the pets in this area the best they can be? Yeah, the best they can be. I'm all for it. Yeah,
thank you. Well, thank you again so much. It's been absolutely brilliant to have you in.
It was lovely to see you both again. Yeah.
And we will see you soon.
I will see you soon in the store. Absolutely.
Okay, and don't forget to like, subscribe, and
Please.
follow Edgewater
Vets.
as well.
Yes.
That's it.
Thank you so much.